Global Conference on Communicating Science During Health Emergencies. Good day. For some of you, it's very late. For some of you, it's very early. But for all of you, it will be very interesting. My name is Melinda Frost, and I'm the lead of the Translate Science team for the WHO Infodemic Management pillar of the COVID-19 response. Welcome, and thank you for joining. We're going to first begin with a few comments from our Director General, Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros? Thanks for joining.
Thank you, Melinda. Can you hear me?
Yes, we can. Thank you.
Thank you again, Melinda. Excellencies, distinguished guests, dear colleagues and friends, good morning, good afternoon, and good evening. It's my great pleasure to welcome you to this global conference addressing one of the most difficult aspects of public health. Amid a flood of rapidly evolving and sometimes conflicting information, how do we best communicate science with the public and policymakers during an outbreak or other health emergency? The COVID-19 pandemic is a disease of the information age. Never before has there been such a plethora of scientific studies on a single disease in such a short time, with over 200,000 articles about COVID-19 published in 2020, according to one estimate. This deluge of constantly changing and sometimes contradictory findings and advice has often created more uncertainty, precisely at a time when people need clarity. Scientific processes, decision-making in an emergency context, and mass communication do not fit together easily. High-quality research takes time, but time is something we don't have in an emergency. The conversation becomes even more gobbled with the deluge of false and misleading information on social media, or that makes its way into political rhetoric and traditional media reporting, or that can spread in phase communities or at the dinner table. The importance of communicating science in a trustworthy and understandable way is especially relevant in the case of vaccine confidence. WHO carefully monitors the safety and efficacy of vaccines we have listed, provides technical guidance for countries to manage vaccine introduction, and works closely with national regulators to evaluate potential risks. But some people do not trust the science behind the vaccine development and fall for conspiracy theories and misinformation. WHO works with countries and partners to thoroughly understand the reasons behind low vaccination uptake and to design tailored community-led strategies to respond. We support research to better understand infodemics, develop clear risk communication messages, and train professionals as infodemic managers. We continuously monitor and review the latest evidence on the virus. We convene the world's leading experts to better understand the drivers and consequences of the pandemic. Through partnerships with technology companies and social media platforms like WhatsApp, we're reaching billions of people with reliable public health information in more than 75 languages. With Facebook, we're studying the effectiveness of social media campaigns on perceptions of vaccine safety. Together with the government of the United Kingdom and Google, WHO is developing a cloud-based platform to provide real-time insights on COVID-19 misinformation around the world so that it can be countered with accurate information. Our aim is to give decision makers, media, and the public accurate information based on science to save lives. Many of us have become science communicators during this pandemic, including teachers, healthcare workers, and religious leaders. And many people have come up with innovative ways to bring science into their everyday lives, including comic books, songs, and videos. But we still need to better understand how we can support researchers, policymakers, media, and the public to translate science into effective, innovative, and reliable communication. With this conference, we want to learn from you. We want to hear your innovative ideas and experiences on how we can make best use of the emerging science during health emergencies. We want to understand how we can make science accessible and relevant to all so that we can navigate this and future crises using facts and evidence instead of falling for panic and rumors. And we want to know how WHO can support you. I wish you a productive discussion over the course of the conference, and I very much look forward to continuing the conversation. I thank you. Melinda, back to you.
Thank you, Dr. Tedros, and thank you for being such an excellent communicator of science throughout this response. Thanks for your time today. As we move on, I'll be facilitating today's session. Just a few housekeeping notes for those listening. The session will run from 1 o'clock to 4 o'clock Central Eastern Time. Please make sure to add your questions to the Q&A function within the Zoom link. We'll be able to pick out those questions and ask those of our various presenters today. We have 5 keynote speakers coming up. You could upvote questions to give them a little bit more visibility. So if someone asks a question that you're quite interested in, be sure to give it a little thumbs up so it comes up further in the food chain so we can answer that. We'll be recording today's session. It'll be available on the WHO website as well as our YouTube channel. Also, we have French and Spanish interpretation available on the Zoom channel on the lower part of the screen. So without further ado, let me introduce our next opening statements from Dr. Sylvie Briand, who's the director of our Global Infectious Hazard Preparedness Unit within the WHO Emergency Preparedness. Dr. Briand has spearheaded this new area of response known as infodemiology. Dr. Briand?
Many thanks, Melinda, and thank you very much, Dr. Tedros, for the excellent speech and introduction to the WHO's Global Conference on Communicating Science during Health Emergencies. I also warmly welcome all participants to the opening session of the conference. We are delighted that you join us from all over the world today, although it's very early or very late for some of you. There are close to 4,000 registrations for today's event. It shows the enormous importance science communication has taken in our lives since the start of the COVID-19 pandemic. It also shows the immense interest and need to understand how we can do a better job at translating science during health emergencies into actionable, relevant, and understandable recommendations so that we can keep ourselves, our families, and our communities safe and healthy. As we heard from Dr. Tedros, the COVID-19 pandemic poses a true challenge to science communication, but also brought the unique opportunity for each of us to become an advocate for science. Over the next 3 weeks, we will discuss how science can be made accessible to all during health emergency so that people choose to trust science instead of rumor and have access to the best information possible. Today, I'm delighted to open the conference with the public plenary featuring 5 passionate science communication experts who will share with us why science communication is relevant for the media, research, policy, and practice, and how we can reach different audiences. I wish everyone an excellent conference, and I would like to hand over to my colleague Melinda Frost, the moderators of today's event, for the introduction of our speakers. Thanks, Melinda. Over to you.
Thank you. Thank you, Sylvie. Great. As Sylvie mentioned, we have 5 different passionate keynote speakers today. It should be quite an interesting program. So for our first keynote speaker, let me turn it over to Dr. Shamila Nair-Bedouelle, who's the Assistant Director General for Natural Sciences from UNESCO. Dr. Shamila has had a long-standing career as a researcher and in implementing international programs for science for development. Shamila?
Thank you very much, Melinda. Good afternoon, good evening, Excellencies, ladies and gentlemen. First of all, my sincere appreciation to Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, to invite UNESCO to this important session on how to communicate science, and especially communicating science during the health emergency as lessons learned for other emergencies. Gives us great pleasure here today. UNESCO stands for the United Nations Educational, Scientific and Cultural Organization and has been promoting science journalism since its inception in 1945. Dear participants, science communication has really come to the fore during this COVID-19 pandemic as the world struggles to understand the calamity that has befallen it. Science communicators have served as a bridge between decision makers, the general public, answering questions such as, where did the virus spring from? How does it infect human cells? And is there an effective treatment? How can I protect myself from this infection? How long will it take to develop a vaccine? So from the outset, the public has turned to science for answers yet one again. Science institutions, advisors, journalists, and others have taken up the gauntlet, communicating to the public on the science behind the virus and on measures to tackle it through interviews, articles, blogs, and other media. But their role, therefore, has been really crucial in communicating and persuading the public to comply with collective efforts to curb this disease. So I'd like to share with you now, if I'm able to do so, would like to share with you a presentation that we've put together on how to communicate science effectively, especially during a pandemic. Here on this slide, you will see that we have entitled our presentation today, Science Journalism Needed, needed now more than ever. And on this first slide, you will see really the role for science in the world today, this pandemic and other pandemics. Science is really the engine of prosperity, from the cars and the trains that got us here, our smartphones, the energy that lights up this chamber, the food that we eat, the clothes we wear. All of these were really developed and improved through research and science. Science can fuel and fire our imagination. It is humankind's greatest enterprise. We need science. We need more and better science, not for its technology, not for leisure, but for our health and longevity, but for the hope of wisdom our kind of culture must acquire for its survival. So how then do we communicate this greatest enterprise of humankind, which is scientific research and advances in science and technology, to improve livelihoods and better life today? On this particular slide, you will see communicating science and the growing importance of science communication. There's a broad understanding of science communication, but communication from and about science, including a diverse set of communicators, contents, as well as users and effects, is critical to today. This is really important for our survival, but also to unite behind the science and scientific data. Now, if one has to look at the 12 quality indicators for science communication on this slide, you will see there are 3 broad categories. First, it is trustworthiness and scientific rigor, which is actually based on scientific and factual, balanced, transparent information. Then the presentation and the style being clear, coherent, contextual, can be also spellbinding, of course, and how to interact with the audience. And then the connection with society, purposeful, targeted, impactful, relatable, and responsible. And that's where we are here today. During this pandemic, there has been a strong demand for science journalism. There is really a thirst for information and a burning desire among people to understand the world in which we live in and the challenges that the world faces today. So science communication has come to the fore during this pandemic. As I mentioned, there has to be an important bridge between decision makers and the general public in answering all the questions which I have indicated to you earlier on. Now, of course, during this pandemic, we have also seen a number of infodemics, disinformation, rumors, and unable to check facts and figures. Where do people get the information from? Is it trusted sources? How do you know that it's true? And how does one sift out between the information we see in the number of blogs and papers and social media compared to the actual rigor of scientific data and information? During this pandemic, UNESCO carried out a survey, and I would like to share with you here just an overview of the survey. What is UNESCO's World? The 2030 survey in 2020 described most of the survey information that was collected, actually described not knowing which information to believe in or who to trust as being a top concern. And these findings therefore led UNESCO to partner with its partners and to make the 16th of May, which is known as the International Day of Light, to actually support science and encourage to sign a pledge to trust science. That was the theme of the International Day for Light this year. So we have seen an infodemic, an epidemic of disinformation about the COVID-19. And as the United Nations Secretary General has also indicated, the COVID-19 spreads a tsunami of misinformation, hate, scapegoating, and scaremongering, which has also been unlashed. So the spread of disinformation through this infodemic had led more than 130 countries to actually sign the cross-regional statement on infodemic in the context of COVID-19 under the auspices of the World Health Organization. In this statement, they observed that the spread of the infodemic can be as dangerous to human health and security as the pandemic itself. Now, we are moving to the next slide. UNESCO's approach is that the freedom of expression and press freedom combined with targeted training is really essential for journalists and scientists to speak out authoritatively against the lies and in favor of truth, supporting the science. In order to counter the spread of disinformation, UNESCO has been promoting what is called open educational resources, networks of fact checkers and resources that actually promote media and information literacy, but also scientific literacy. So UNESCO has organized this multilingual, massive online courses, which we call MOOCs. You all are familiar with them, to help to cover the science around the COVID and the vaccination debate. So more than 7,000 journalists worldwide has actually benefited from this type of training. And we also collaborated with SkyDev, one of the world's leading sources of reliable, authoritative news on science and development in the developing world, and other regional partners to actually organize the panel discussion for African journalists and health experts documenting the lessons learned and how to overcome fear, panic, and fake news related to COVID. On the next slide, you will see the Science Museum and Science Centers. They're actually UNESCO's main partners in promoting the scientific culture and popularizing science. UNESCO provides technical assistance to help countries to develop and manage these science centers around the world. And the science centers are effectively promoted on World Science Day on the 10th of November each year, where we ensure that there is science and science is speaking to the people. So given the difficulty in providing technical assistance during the COVID-19 pandemic, UNESCO, in cooperation with science museums, is elaborating actually a manual for setting up a multifunctional science sector and science museum. Furthermore, the challenges for interactive science centers and science museums are actually based on hands-on experiments and has been a huge benefit also during the COVID-19 pandemic. So there's a need to innovate and to develop new safe interactive models to use and operate exhibits. So the manual will not only help the centers and science museum, but also help the journalists across the world. Now, what is the future of science And how can we ensure that science is really at the forefront, responding to development challenges, needs, and that science is really evidence-based towards policy making? The lessons from the COVID-19 are glaring. There's an importance of timely and freely accessible scientific data, publications, and information. Another lesson is the importance of scientific collaboration, sharing of information at all levels, and the importance of the science policy interface. And this nexus is really important to promote this dialogue, to ensure that we have evidence-based policy making based on the best science available today. So there's also importance of the human right to enjoy the benefits of scientific progress. And that is why UNESCO is chartering the UNESCO recommendation on open science. The need for open science has never been so glaring as it is today, and brought forth by the pandemic. So last year, on the 27th of October, the Director General of WHO, Dr. Tedros, together with the United Nations High Commissioner for Human Rights, and the Director General of UNESCO, issued a joint call for open science. Open science will be a game changer to ensure equal benefit sharing of latest developments in science and technology, and to ensure that no one is left behind. The open science is being developed by UNESCO through wide stakeholder dialogue, and it can help to disseminate scientific information and in other research fields to decision makers and the public at large. The recommendation hopefully will be endorsed by the member states of UNESCO during the General Conference in November this year. Now, this recommendation on open science also affirms that the dissemination of scientific information through scientific journalism and the media, and the popularization of science, open lectures, and various social media communities are really important to build the public trust in science, while increasing the engagement of social actors beyond the scientific community. This recommendation on open science also observes that to avoid misinterpretation and dissemination of misinformation, the quality and the appropriate citation of original sources of information are of paramount importance to science communication as regards open science. And the open science recommendation also calls for the sharing of scientific information and scientific knowledge to bridge the gap between countries and nations. However, one key challenge, as we all know, is that 72% of scientific publications are not yet available in open access. Now, the trend towards more scientific publishing and more international scientific collaboration, as indicated here, is also highlighted in the UNESCO Science Report, which is produced every 5 years, and it actually identifies the world trends in scientific collaboration. It will be launched on the 11th of June this year, and I invite you all to join us. It calls for smarter development and really highlighting also the lessons learned from the COVID. This document, which is to be launched very soon, actually highlights that scientific publications produced globally in 2019 was 21% higher than in 2015. And among the low-income countries, the number of scientific publications surged by 71% over the same period. However, we do need more international scientific collaboration. So what are the key issues to pay attention to? Well, we have the experts for providing documentary communication, we have the science communication, we have the government, and we have public. And all of these play an important role in systematic communication, the documentary communication, approachable communication, but also communicating scientific facts. And this is what the COVID had brought out. So on this slide, I just want to highlight some of the ways in communicating science that we've noticed during the COVID that has come out in highlighting the role and importance to communicate the rigor of science. Is that science is advancing, and initially there were discussions that there were no treatment protocols, and then scientists started understanding the virus using drugs originally that were used to treat Ebola. In treating COVID patients, WHO put together advice for public based on available scientific advice, and some of this can be modified since science evolves, and science is a domain that produces new evidence constantly. So in normal practice, science is also adjusting to new evidence. And we see today, for example, there are several vaccines which is approved for use by WHO, but now many people have started discussing about the efficacy. So it's a duty of science journalists also to follow the pace of the advances of science and also to produce this information in real time. WHO is, of course, the competent authority to make decisions on this issue. Now, on this particular slide, just to show you some of the information that came out in the journals about correlation and causation, which where we understand that correlation is not always causation. For example, there was information about BCG vaccine, which is known to treat tuberculosis. It might be used against COVID-19, and the claims actually originated from research papers which were not peer-reviewed. So therefore, one really needs to pay attention to peer-reviewed scientific information in order to report these correctly to the public. Now, peer review is, of course, extremely important. We call for scientific review, but we also call for peer review on scientific research. And it means that as a journalist, therefore, you must check whether a paper has been peer reviewed because you rely on it for your reporting. And WHO reports points out that the fundamental flaw in research papers that actually linked the BCG vaccination to lower COVID prevalence did not actually depend upon the peer-reviewed journals. So papers were posted online without actually going through the peer review. So scientific consensus and the false balance, as we've seen here, is extremely important, especially during a health emergency like what we had during the COVID. So regarding COVID-19, there have been dissenting views already emerging on how to report and how to pay much more attention on false equivalence. For example, some scientists are actually doubting whether all reported deaths actually due to COVID, but we need to be extremely careful on the science that is being portrayed and the actual rigor and how scientists are actually portraying this also in their scientific publications and how the journalists are capturing this and what different types of consensus positions are being presented to the public so that policymakers can make informed decisions. Now, on this, my almost last slide, we know that there is a speed in science, the speed with which research has been done and papers published on COVID. Dr. Tedros has highlighted the large number of papers that were published on the COVID. It really is unprecedented. We have never seen such a large publication in the public arena as we've noticed concerning the COVID. So it raises concerns that sometimes scientists could be doing an unpolished job, and therefore we call for peer review. It is a must. Indeed, the Reuters published in February 2020 that maybe some of the papers need to be questioned and need to be peer reviewed before the journalists actually highlight them to the public as scientific information on COVID. Now, here, just for fun, we'd like to share with you a slide on the absence of evidence is not evidence of absence. On April 24, WHO reported that there was no evidence that recovered patients cannot be reinfected. This does not necessarily mean they can be reinfected. It simply means that at the time of making that statement, they didn't have the evidence. As I said, information is evolving continuously, scientific research is advancing, and every day we learn much more about the virus than we've ever done before. So therefore, the network that has been put together on the definitions of medical terms need to be fully understood by the journalists who are actually reporting on the COVID-19. And it can help you to interpret and to simplify the terms in layman terms to present this to the public. So we have seen the COVID fake news throughout this period. The internet is awash with unverified and really sometimes outright fake claims about COVID. The Reuters Institute report also indicates that about 59% of the misinformation they sampled was actually misinterpretation of existing facts, while 38% was completely fabricated. Whereas only 20% of the misinformation came from politicians, celebrities, and other public figures. This accounts for 69% of the social media engagement. So it's important for journalists to fact check any COVID-19 information you may find on the internet or social media, because people depend on this and people's health, people's future, and really depends upon the information produced by the journalists. So what are the policy actions that could be taken to improve science journalism? Firstly, designing practical and continuous educational and training for journalists and scientists on science journalism, encouraging and developing new ways of interactions between scientists and journalists, but also reiterating the role of states. Governments have a critically important role to play in how science is communicated to the public at large. And I would like to really call for governments to rethink and relook at their role in science journalism, because the quickest way to reach public with scientific information is really through the media. And during this health crisis, we have seen how important it is to report on the science and nothing but the science. So thank you very much for your attention. Looking forward to this dialogue with you. And once again, thank you very much, Dr. Tedros, for this very important and timely meeting today to set the stage for all reporting, because it is critical for policymakers and science journalists and governments to come together with the scientists so that the message from the scientists and what comes out of laboratories and scientific information is communicated properly with due respect for the science itself. We need to unite behind the science and nothing but the science. So thank you very much.
Thank you, Shamila, and thank you for that very We have just one small technical difficulty, so give us one moment. Okay, let me try again. Yeah, you can hear me now? Okay, great. Apologies. I will go back. Thank you, Shamila, for that very impassioned presentation. It was really a wonderful way to start the conference. Thank you so much. So we're going to move now onto some questions and answers and a discussion between Shamila and Sylvie, between UNESCO and WHO. We do have a number of questions that have come in on the Q&A function of the Zoom. And so I'm going to go ahead and start off with the first question, which has something to do with the presentation you just gave in terms of the science, policy, and society dialogue and the movement towards open science. So our question, I'll start with you, Shamila, and then move to Sylvie for a response, is how do we balance the political agendas that have often sort of stepped in the way of better communicating science throughout the COVID-19 response? We'll start with Shamila. Still not hearing. Okay, we'll start with Dr. Briand for an answer.
Yes. Thank you for this very important question indeed. And this is, in fact, something we have been struggling with because very often decision makers, they need to make decisions at a time where the information is scarce. And as we have seen earlier on, that it takes time to have strong evidence on certain things during a pandemic in particular. Even if the science is evolving very fast, still at certain time you have only a very small evidence, and scientists, they know that this evidence is not very strong, but they still and they continue to look for more evidence. While in the meantime, decision makers and politicians, they have to make decisions. They have to also convince their population that the decision is made based on strong evidence. So they tend also to quickly take the limited evidence available to make their decision. So this issue of timing is very difficult, and this is why we have been struggling, especially at the beginning of this pandemic, because this disease was not known. It was a completely new disease, so we had to basically define everything from scratch, and it was extremely difficult. And so I think it's important to have a good communication also with decision maker before pandemics, to better explain also by the process by which science is made, why science takes time, because we need confirmation, verification, and why sometimes scientists are a bit reluctant to jump on conclusion, because they know that they have only part of the information, and they need more to have strong conclusions. So I think this is something, as Shamila said, that we need to work on, so that there is better communication between the different audiences and the users of this information, the ones who produce it, the scientists, but also the other audiences, so that they understand really what is this information about, what is the quality of this information at this point in time, and how they can use it as best as possible. So and I think if we increase this understanding, it will be also easier to prevent of such information, whether it's by decision makers. Okay,
yes.
sorry.
No, go ahead.
Okay, we have a small problem. Sorry, a small technical problem. We are trying to fix it. So.
Okay, can you hear me now, Sylvie?
Yes, now I can hear you very well.
Okay, thank you.
Did you?
You want me to answer, maybe, from our experience?
Okay. Yes, please.
Thank you, Sylvie, and thanks to Melinda. So I just want to fully agree with you that I think in the face of disinformation, the scientific literacy is really important, and is very important to separate fact from fancy. And the role of the science communicator is essential, and I fully agree with you. The science communicator needs to provide accurate and timely information to help the public actually to understand the key issues and to recognize the disinformation. So I think perhaps what we also have seen here is, as you rightly indicated, Sylvie, the evolving nature of the research that was being produced continuously, which could create perhaps some confusion also among the science communicators. And that is why an understanding of the role of science today and the nuances also of the science is extremely important to prevent misinformation from developing, but also that the public at large to understand that scientific research is an evolving mechanism. It requires rigor, verification, and it's really based on facts. And therefore, the role of the science communicator is also so important in communicating the facts to the public and to policymakers. The policymakers need this information for them to design the programs that were needed to combat this health pandemic. But at the same time, the scientists also need to be able to probably present it in a way that could be understood and communicated better also to the policymakers. Thank you.
Thank you. Just a few technical difficulties today as we talk about science and communication. I hope I'm heard now. Can you hear me now? Great. Okay, thank you for your patience. So Shamila, you spent a lot of your presentation really talking about the importance of journalists and their critical function. And we've done a number of activities in trying to better reach journalists and ensure that they have updated information as quickly as possible and can communicate that in a way to their audiences. We view them as really an important part of the response when it comes to health emergencies. Can you just talk a little bit more about unique ways, different ways that we could be reaching out and working with journalists in the future, having learned what we've learned from COVID-19?
Yes, thank you. Thank you very much, Melinda. We have, I think, the experience of UNESCO in working with journalists over the years, communicating climate science, communicating biodiversity decline, came to the forefront during this pandemic, where UNESCO had actually organized a meeting in Africa for health journalists and their reporting. We have produced also a number of training manuals, which are very critical for journalists to understand how to report on the science. We have a number of these training manuals and customized handbooks, and we organize training for journalists throughout the world on different areas of UNESCO's competency. So I think this could also be an area in which maybe a number of different agencies and organizations could team up in order to ensure that we do have the proper training of science journalists. This is really critical as we look at other emerging threats in the world today, such as climate change and reporting on disasters and disaster prevention. Thank you.
Thanks, Shamila. We have another question from the audience on how can organizations best address language barriers in communicating essential health information. It's not just maybe a matter of making sure that information is in somebody's native language, but then also addressing health literacy issues.
Thank you, Melinda. This is really a critical question, and thank you for the participant for asking this question. We all come from different cultural backgrounds, and we definitely see things in a different way, understand them differently, interpret them differently. And the COVID has brought to the highlight also the cultural differences in accepting and understanding this pandemic. And that is why it is critical to communicate in the languages that people understand the best. We have 6 official languages of the United Nations, and we have tried to do a number of different trainings across the world in different languages, in language in terms of communication. But whilst we organized a number of workshops across the world during the COVID, bringing together the scientists and the innovators and the youth, we came to understand that the manner in which they interpreted the pandemic itself, the impact on the populations, even reporting of the disease, and the stigmatization brought forth the role of cultures in society in actually combating this disease. And that is why it's critical and crucial to also understand the cultural dimension of the societies and the communities to combat such a disease. And I believe that this is also a critical part for science journalists in the manner in which they communicate the information to media and the way it's relayed to people, the way it is simulated so that we could combat diseases like this in the future faster and better. I think this is one of the lessons learned from the COVID.
Thanks, Shamila. We have another question, and I think I'll turn over to Sylvie for this one. Throughout this response, as WHO continued to develop messages and communicated our science as quickly as possible, a lot of our discussions behind the scenes with the response were about fear and concern of our populations. So Sylvie, can you talk about a couple of effective strategies to address both perception challenges and things surrounding, issues like this surrounding the population in terms of fear? That could be vaccination, the disease itself, and so on.
Yeah, thanks a lot for this very important question. And indeed, epidemics or pandemics have this characteristic that not only it's an event that goes very fast and requires from scientists to move very fast, but also it's an event characterized by fear. And as it has been illustrated in many movies, fear is more contagious than the virus itself. And so that's why dealing with fear and people's emotion is as important as trying to accumulate as much knowledge as fast as possible. And those two things are complementary and very important for the response. So that's why, for instance, we have a tool now to monitor conversation online called EARS. And this tool allows us to understand what are the questions people are asking about vaccine, about mask, about transmission, about treatment, about the symptoms of the disease. So it enables us to understand what people know about COVID-19 and what they want, what else they want to know about this disease. But at the same time, we are also monitoring the sentiment of the population. Are they asking this question because they are fearful, or are they asking this question because they are hungry, because they feel that somebody has not told them the full information? Are they, or otherwise it's a neutral question just to understand what is going on? And so for monitoring the sentiment of the population, it's very important because then we can adapt the message to those sentiments. And we see, for instance, there was a lot of question about the vaccine a few months ago because vaccines were developed in a record time. So from the scientific perspective, we see this as a fantastic progress of science. And we were all very happy to have a vaccine available less than 1 year after the start of a pandemic. But many people were really concerned about this fast availability of vaccine. They said maybe the tests have not been done with the rigor that is expected usually for vaccines. Maybe they shorten the verification, or maybe there is something wrong with the production of this vaccine. So we understand those concerns, and this is where we have to explain a little bit more, not only what has been done for this particular vaccine, but also what we do usually for all vaccine, and explain why this time it has been possible to shorten the time between the start of the production and the availability of this vaccine. Make people understand why the quality control has been done on this vaccine as well, and so on and so forth. So be much more detailed in our communication, not only addressing the question on this particular vaccine, but also broaden the answer to other vaccine or other processes, and explain the difference between a treatment and a vaccine, and the different type of vaccine, and so on and so forth. So I think it forces us also during emergency to take much more into consideration the sentiment of the population at a given time, and trying to adapt our communication to the feeling and not only to the need for information. Thank you.
Thanks, Sylvie. And we'll just go to one more question before we'll take a short break. So one of the questioners has asked about the role of trust in scientific communication. We all know that it's vital in shaping public opinion and behavior. So what are we going to say are the key learnings, or what would you say are the key learnings from the communication around the surge of COVID-19 and later around the messaging around vaccines? And what could have been done, what could be done differently in the future? Maybe we'll start with Sylvie, and then we'll go to Shamila for the final comments.
I think the vaccine is a very good example of where science is very much needed, because the vaccine is something quite complex, actually. It's very technical. And requires a lot of know-how to produce vaccines. So it's not something you can do everywhere. It really requires a lot of scientists behind the scene to make sure a vaccine can be available. But in fact, because it's very technical, very complex, it's also very difficult to explain in simple terms. It's very difficult to make people understand how a vaccine works. And also we have seen recently with some publication on the adverse event related to vaccine to make people understand that it's normal to see adverse event. We always have adverse event with vaccine, but some of them are really minor. Others are more important, and the role of scientists, doctors, public health officers, and so on, is just to minimize the risk as much as possible. And this is what, when policymakers are making policies about vaccination, they really try to maximize the benefit and minimize the risk. And all these things are really complex. But it has to be explained, and it has to be explained in simple terms so that people understand. And people can also make their own mind and their own opinion on the issue. But it's very difficult to explain it during a crisis, because during a crisis, everybody is fearful, everybody wants rapid answer. And so that's why it's very important to do communication on vaccine outside crisis as well. And as you mentioned very well, Shamila, is this scientific literacy that is very important. And scientific literacy doesn't mean that everybody should be a scientist, but everybody should have the basic concept to understand science. And for instance, it's very important that at school kids are taught about immunity, what is the immune system, are taught about, okay, you all have been vaccinated as children, what does it mean? Why are you better protected if you are vaccinated than when you are not vaccinated? Explain when sometimes there are adverse events, what does it mean, etc. So having a conversation on health and the way to protect health regularly, not only during crisis, because during crisis it becomes much more difficult and much more complex, especially when you have a completely new vaccine, and that even scientists themselves are still in the learning and trying to record all the information on a particular product. So this would be, in a nutshell, what I suggest is that we don't stop communicating about science when this epidemic or pandemic is over, but we continue our work and even intensify it even after COVID-19.
Yeah, thank you, Sylvie. Would you like to comment on that, Shamila, for some last comments for this session? Oh, I think we may unfortunately have lost Shamila. Thank you.
Maybe I can add something on this. I think this is why, because Shamila is not apparently connected anymore. It's freeze. The screen is frozen. But I think this is where the role of scientific journalists is so important, because they need to maintain this communication also between crises.
Thanks, Sylvie. Yeah, definitely during the preparedness phase, we need to stop what we tend to have, this paralysis during preparedness, and get ready for the next emergency. So thank you. We're going to take just a short break before we move on to the next portion of our program. So step away from your keyboards, quick break. We're going to come back at the top of the hour and hear from another couple keynote speakers. Thank you very much.
Yeah, no.
Hi, Melinda. Can you hear me now?
Yes, Shamila. Is it Shamila?
Put the video. Yes, I'm really sorry. There seems to be some connection problems today. I'm now come to another office to be able to read you just one last word, if I may, please. Yeah. So really one parting message is that journalism and science are symbiotically intertwined, and both really have the interest and welfare of the masses as their core objectives. So in this regard, this symbiotic relationship between science and journalists must be harnessed so that we can have, they can be informed of scientific concepts as a way to improve public health care standards. And it's very important also to take policy actions to improve the role of science journalism, even for the future, beyond the public health communication. It's critical. Thank you, and apologies for these connection problems. And thank you once again to WHO to invite UNESCO. Thank you.
Thank you so much. Thanks for providing such a great opening to this conference. All right.
Thank you.
Now we'll all take a break. We'll take a break for a couple of minutes and rejoin again, and just about 4 or 5 minutes at the top of the hour. Thank you.
So what happened?
What happened? I think you have to restart.
Hello, welcome back. Welcome back to the WHO Global Conference on Communicating Science During Health Emergencies. We're going to move on now with our next two keynote speakers, followed by a discussion with you, the audience, and these speakers. So first, we're going to hear from Dr. Vish Vishwanath, who's a professor of health communications in the Department of Social and Behavioral Sciences at the Harvard Chan School of Public Health. Dr. Vishwanath's work is drawing from literature around communication science, social epidemiology, and social and health behavior sciences. His work focuses on translational communication science to influence public health policy and practice, and his primary research is on documenting the relationship between communication inequalities, poverty and health disparities, and knowledge translation to address health disparities. We're going to hear his presentation today, which is titled Drinking from a Fire Hose, the Communication of Science and Risk During the Pandemic and Infodemic. Drinking from a fire hose, by the way, completely describes my entire last year and a half. So thank you, Vish. Thanks for joining.
Thank you, Mandy, to you and the rest of the World Health Organization team for inviting me to share my thoughts on this very important topic. Obviously, WHO's lead role in this is critical given the span and the scope of your global influence. And I cannot even imagine what you all must have been going through the last 16 months. So I particularly applaud you for hanging in there and continuing to do what you're all doing in these very difficult times. And I enjoyed thoroughly Director General Tedros' opening remarks, as well as Dr. Brand and Dr. Shamila. They actually covered a lot of ground. So what I'm going to do, I'll just try to highlight. Let me see if you are able to. I'll share my screen. Are you able to see it? Great. So what I want to do really is provide you with some 5 takeaways. Essentially to sensitize you to some of the issues. I don't think I will have the time to go into great depth on any single one of them, but I will be happy to amplify some of these issues in the question and answer session. And I'm fairly certain that this will be covered also by other speakers. I think the 5 takeaways really are, I think one of the things that the difficulty in communicating science or communicating evidence, quote unquote, of any kind is that the sheer proliferation of platforms of information or misinformation. As you know, by this time, I think, it's not rocket science for most of us to realize that these information platforms have led to a generation of tremendous amount of information and the dissemination of information. And these data are being generated from very different sources. But what is unique about this is a networked environment. It's not that this is coming down from top down or in one-way flow, but this kind of a networked environment which allows this misinformation to circulate, which is providing challenges, right? So, and these data are very well known, so I don't have to go into a great deal of depth in there. I think, the platforms, including the rising of the growth of internet, but more critical, as has been already alluded to this morning, is the role of social media. I think, almost, 50%, 60%, 55% of the population of the world are on social media of some kind or other, where they're able to engage and participate. So that's the good news, right? That engagement and participation is actually good news. People try to look at social media as a bad thing, but actually there is a particularly positive side to that. Unfortunately, it has also a negative side, which is where, that engagement and participation means that bad information is also circulated and generated. In addition, there's a lot of other information being generated constantly. This is what I mean by fire hose, because it's just that those of us who are in this conference and on these, in our day-to-day occupations are concerned about information and facts and evidence and science, but people are interested in other kinds of things. There's a lot of other things, other stuff, quote unquote, stuff that is going around that makes them, really difficult to handle and tame the flow of information. So the Director General has actually talked about this, right? Even a cursory, crude search on PubMed shows that there have been close to 150,000 articles or peer-reviewed papers. And this is just for COVID-19. So if you include other terms, there are more than 200,000. So what does it mean? If you think about it, all of the science is happening in very compressed time, right? That is not giving us time to process this information, evaluate this information, or assess this scientific information, which is possibly leading to these challenges. But in addition to that, you have, as I said, the network environment through social media where people are able to participate in the conversation in some ways or other, including, as you can see, the number of pages on Facebook. These are just the public pages, or the number of tweets, almost 1.5 billion tweets that have been sent around this COVID-19. So the point I wanted to make is that this kind of information deluge is something that we have never seen in our lives. But more critical, I think, and less appreciated is the fact that a lot of this is happening with no gatekeeping. We talked about journalism early on. The point about journalism is that there is some gatekeeping where people are able to separate facts from fiction, from the signal from the noise. But now we don't do that. We can't do that because of these, the kind of a networked environment we have. Second, who is producing health or science or risk information? Who is generating them? That's information. Now, we just spent an hour or so talking about from a science perspective, but the interesting thing about this is it's just not the scientists, it's just not WHO or UNESCO or Harvard or other places, but actually, the interpretation of it is through mass media and journalism, which we all acknowledge is very important, the health systems, but also the private sector, the activist groups, plus we have the user-generated content. So what I mean is that every fact, evidence as we like to call it, is contested, right? So science has always been contested, but it is contested in such a public way. And now with the social media, people have become, producers of information and disseminators of information, right? So that's what I meant by network effect. It's not that somebody else is producing this information. Anybody can go and do this on social media and have their own interpretation of science, I think. The third point I wanted to emphasize is that information is not communication. Again, this is very obvious to some of us who are in this business day in and day out. But we have to be able to distinguish between information, misinformation, and disinformation. Right? Information is something we understand, as my colleagues, David and Brian and others have said. There is some kind of an epistemic consensus. But misinformation and disinformation have amplified. They have always existed. It's not that they did not exist, but they have amplified as a result of this networked environment. So even though from a WHO perspective, from our perspective as those who work in this business are communicating facts, what people are actually exposed to is this kind of information in a variety of languages, making recommendations about treatment, interpreting the spread of the disease. And that is the challenge that we are facing, where what we think of information and that is being generated is actually not communicating. And then with the chatbots, so we have an entirely different game, where studies have clearly shown how certain groups have taken advantage of this kind of a lack of gatekeeping and algorithms to amplify the misinformation that is widely extant and widely prevalent. And these are some of the reasons we are facing these challenges, not that we are not doing a good job as those of us who are engaged in the enterprise of science, but the challenge remains for us that even if whatever we are trying to do is continuing to have an influence in terms of it being countered, by other people. So the sheer flood of health information is just overwhelming. Plus, the culture of science and scientific production and science communication is very different from communication, which is episodic, right? And people think when they're exposed to it, scientists can't make up their mind because they think it's contradictory and conflicting. So somebody has already alluded to this, in terms of innumeracy or health literacy or science literacy. But actually, as one of my colleagues, former postdocs, Dr. Nagler, says, even research literacy is very important because science, people have to understand how science works and the evolution of knowledge. If you think about it, 16 months ago, 17 months ago, we did not know anything about COVID-19. Within a short span of time, we have learned a lot, but that production of knowledge has not kept pace because, as science usually happens, it contradicts itself. Of course, science evolves, but public appreciation for that evolution of knowledge and the starts and, the fits and starts of science are not very appreciated. So that creates a kind of a challenge for us in this thing, right? And so what are the consequences? So the consequences are, this is one of the data, charts we have from one of the studies we have done. The higher you score on knowledge or on information and the lower you score on misinformation, the more likely you comply with public health mitigation measures. This is very critical. So information and misinformation has potentially deadly consequences. It has direct impact. This is a correlation, of course, but this is a direct impact on whether people are complying or not with public health mitigation or public health recommendations. That's the reason you're seeing this kind of a spread of information. The other point I wanted to make is, health and communication inequalities. For this audience, I don't have to talk about that health, like wealth is unequal. There are health disparities and there are a variety of reasons why there are unequal health outcomes. But what we have been working on towards the last decade or 15 years or so in our lab is focusing on communication inequalities, which parallel health inequalities. By communication inequalities, we mean differences in generation, processing, and distribution of health information between different groups and institutions at the macro level, and differences in accessing, processing, and using health information, including, precluding certain groups from taking advantage of the information at the individual level. So it is like, it is very much a parallel with health disparities. So when we are trying to explain health disparities through social determinants, we have been arguing and documenting systematically there are dimensions of communication inequalities, whether it's in engaging with information, whether it's accessing information, whether it's processing information or acting on it, that leads to these inequalities. And these have been very well documented, which has clearly shown class matters, race matters, and ethnicity, place matters, but also policy matters. The reason I'm saying policy matters is inequalities are not natural. They are by design. They are a social construction. Inequalities can be addressed with the right kind of policies. These are not natural. So it's within us, our purview to address them, I think. And plus the issue of data absenteeism. We want data from a variety of places. Unfortunately, most of the data we have are from advanced industrialized countries. We don't have a lot of data from low-income and middle-income countries, especially on the behavioral sciences side of it. That provides a significant challenge in terms of addressing or making data-driven policies. This is a good example. I can go on and on for the entire day showing how digital inequalities are prevalent widely in the world, despite my earlier argument. And here is a good example of from the US, of what schooling can do, but not everybody can take advantage of schooling. For example, higher education people with greater schooling can score higher on knowledge, compared to people with less education. That by itself is not surprising. And of course, whites, are scoring higher than Blacks and Hispanics. But what is interesting is the intersectionality, right? As we study these communication inequalities, that whites with less education are able to score higher than Blacks with more education. And that is what I'm saying is our interventions, such as education and schooling, is also unequally benefiting certain groups, which means the responsibility is on our side, right? Not on people. And then, of course, there's a mindset of scarcity. There is a tremendous amount of stress and tension, particularly if you are poor. There is, you're making differential allocation of your attention, which is a finite bandwidth. There are pressing demands. You're juggling a lot of things. And so if you're asking them to also think about vaccination and COVID-19, it's cognitive overload over everything else they are thinking. So I think this is a huge challenge in terms of inequalities. And if we don't address inequalities right from the beginning, we will be in trouble, I think. So the consequences are lower knowledge, norms conducive to unhealthy behaviors, limited or no access to services, inability to act on opportunities, and higher disease incidence, prevalence, and even mortality. So what can be done? This is my last point, right? There are 3 points that are very critical here. We have to understand the science of message construction, not just facts. Science of engagement, how do we engage the public? Third, participatory science, which includes responsive feedback. So what I mean by that is, what you say is important, but how you say it is also important, right? We are in tendency in science communication to provide facts, but without appreciation for understanding the importance of emotions, because we think only rationality, rational behaviors matter. But it's a question of bounded rationality. We use generally negative emotions, fear, but we have not yet done enough work to understand positive emotions in communicating, say, addressing vaccine hesitancy, joy, freedom, family. Also, other formats, narratives or framing. One example, if you take framing as an example, is domestic violence a women's issue, or is it a public health issue or a community issue? Depending upon how you define it, leads to certain kinds of solutions. If you say it's a women's issue, it's a different kind of a solution, individual level. If it's a community issue, it's a different kind of solution. And stories have been very widely used in addressing these issues. The reason I'm saying that is how you construct a message matters as much as what you say. Plus engagement of stakeholders. I can give you a couple of examples. We have been working very closely for almost 15 years with our communities to understand what is going on in the community. All our communications are now designed as a result of our engagement with the communities. After hearing from them about this is a completely different project on cancer, but we heard a lot about them on COVID-19 very early on. By January or February, they were talking about how they are confused. Community members have difficulty accessing reliable information. So we changed our complete strategy in providing this kind of a dashboard. And this is one from India. Again, we were working on these things to create this dashboard, and only this is possible because of stakeholder engagement. We've been able to engage the community right from the beginning to do that. The last point I want to say is participatory science. Make people a part of the solution. For too long, we do it top down, but we have to be engaging people as a part of the process, as a part of the solution to the problem. This kind of a co-production. So we have a very good pulse on the people. We constantly collect data. We can't always do surveys, but we are always tracking information through our key informants and chat groups and social listening to identify what are the issues that are coming up, and then trying to redo our messages, re-strategize to really reach out to people. So the point I wanted to say, and I want to end here, is that if you really want to address these things, we need a new approach. We have to completely upend the model of scientific communication or science communications to take a laser focus on the underserved, engage the community, and where science communication is participatory with feedback loops built in. Otherwise, we'll continue to do the same thing, And as we say, the cliche is, if you're in a hole, the first thing to do to get out is stop digging the hole. Thank you.
Thank you, Vish, and thank you for another very impassioned presentation. What a great start. And it's wonderful to hear about your work and what you've been doing throughout this response. We're going to move now to the next keynote speaker, followed by a discussion then with Vish and our next keynote speaker, Dr. Susie Wiles. So we invite you again to put in your questions into the Q&A function, and we'll be pulling them out for the discussion that'll follow Dr. Wiles' presentation. So we welcome Dr. Susie Wiles, who's an associate professor at the University of Auckland in New Zealand. Dr. Wiles has won numerous awards for both her science and her science communication. We've become quite familiar with her work here at WHO, as when the pandemic started, Dr. Wiles joined forces with an expert cartoonist and began to work through and help science and COVID-19 become more clear and understandable to different audiences. And you've probably seen much of that work that we've also used here at the World Health Organization. Dr. Wiles will be presenting on demystifying the science behind the COVID-19 pandemic. Susie?
Thank you very much. So I'll just share my screen and you can all hear me okay there? Yeah, great.
Yes, we can.
Okay. So thank you so much for the invitation to present today. And I guess what I'm going to cover a little bit is about something that Shamila and Sylvie both talked about, which is the importance of communicating when we're not in a pandemic. So that's something that I've been really passionate about for a very long time. And I feel like I've spent 10 years learning how to communicate science outside of, of a crisis. And that so when COVID-19 hit, I felt like I was in the right place, the right time. My expertise is in infectious diseases, but I've had this long, I guess, history of science communication. So I guess I call myself a scientist communicator rather than a science communicator because I'm very much an active scientist. I run a research lab, but I'm really passionate about science communication. And that's because I really firmly believe that science and research doesn't end with the journal publication. You know, your science is really needs to be accessible to everybody who might need that knowledge to be able to work on it, whether in health, it's, you know, doctors and nurses and other health practitioners or other communities. So this means that for the last 10 years, I've been doing lots of different things. So I started with blogging. My blog was called Infectious Thoughts. And I used to put a post out every Monday that was just talking about different papers that I'd been reading or explaining the science behind different outbreaks of things around the world. Through that, I then ended up being asked to be a science commentator for one of our national radio programs. And so this has been a really fantastic opportunity to every fortnight pick 2 to 3 science stories, so new papers. And what I wanted to do was not just talk about, you know, the headlines, but actually how do scientists find out the things that the papers were about. So I've really tried to use that to talk about what the process of science is, you know, how do you do experiments, these kinds of things. I've also worked with graphic artists before. So many years ago now, I worked with an animator called Luke Harris in Australia to make little animations about creatures that glow. So my interests are bioluminescence, glowing creatures, and the use of that in science. And so we made animations about fireflies. This is the use of the firefly luminescence reaction by NASA, but lots of other things like that. And then through those videos, I made one about a creature called the Hawaiian bobtail squid and how it glows. I then was asked to do some art things. And through that, then ended up working with my daughter, Eve, and making a little kids show about microbiology, where we covered things like bioluminescence, we covered microbiology in food and all sorts of things. And I've also written a small book about my specialist subject, which is antibiotic resistance. So through all that I've done, you can see that I've kind of learned how to communicate to different audiences in different ways over the last sort of 10 years. And so when the pandemic hit, I just, my phone started ringing because in New Zealand, I've become one of the sort of go-to people for the media when it comes to infectious diseases things. And so I started, you know, talking to journalists about what we knew and what we didn't know and what we would need to find out. One of the things that's, I guess, that's not great about when you just do media interviews is that, you know, you're really stuck with little sound bites and stuff. So the other thing that I started doing was writing for a online media organization here in New Zealand called The Spin-Off. And what was great about that was I got to talk about all the nuance, everything that I was, you know, reading about or questions that I had. So I could expand on everything that people were hearing me talk about in the news. But through that was where my collaboration with the cartoonist Toby Morris started. So Toby is a cartoonist who works with the Spin-Off and does a lot of graphics for them. And so back in sort of February last year was when I asked whether he wanted to, was available to work with me on something. And that something was this graph that I'd seen shared on Twitter by Drew Harris, which was the concept of flatten the curve. So I wanted to write about this in the spin-off, but it was really clear to me that this graph is a really important concept, but the graph itself didn't explain how all of us were part of this idea of flattening the curve. So the idea that we could slow down through our actions, how the pandemic progressed to try and keep cases below the ability to look after people. So I asked my editor whether he thought Toby Morris would be interested in working with me, and within an hour, Toby and I, who'd never met before, were basically on a phone call. So by that time, in New Zealand, we were already working from home. So both of us were working from home. We jumped on a phone call. And then a few days later, this graphic appeared, which was our version of flatten the curve. And what I'd wanted was something that would toggle between these two options. Sorry, my cat's getting in the way. Toggle between these two options, but show you from a personal perspective what were the kinds of attitudes that we had, and then how that might impact on how the pandemic progressed. So it toggled between this not worried about it versus not panicking but being careful. And so we made this graph. It went absolutely mad. Oh, one of the really important things was that I wanted us to release everything under a Creative Commons license, so that we explicitly gave people permission to share and adapt everything we made. This was something that I didn't know whether Toby would be willing to do, given that he is an artist and he makes his living on graphics, but he very quickly said absolutely. He agreed with me that it was important that people could adapt the work if they wanted to. So we released this on social media. We put it together with a longer form piece that I wrote explaining the concept, and very quickly it had millions of impressions and started to take off. And then very quickly we saw people starting to change it to put it into different languages, which is one of the beauties of, I think, doing this kind of communication. So that sort of started our collaboration. We then, our bit that you might have seen was the next one that went viral was this one explaining the concept of exponential spread, and then also how our individual actions could stop us being part of a transmission chain. And so these were things that were very relevant to us here in New Zealand, but very quickly this graphic was adapted by governments, by organizations, to make it fit the situation wherever people were. We saw this adapted by, as I say, by different governments. These are just some of the examples that we've seen in different countries. We've even, one of those pictures there is on a bus stop in Germany. So lots and lots of people use this. But and we also had one where somebody converted it for use in the youth justice system. So that was quite confronting to see where our pictures of, don't go to a barbecue or something like that became much more serious. So from then we've basically worked on everything that we could in order to try and get people to understand things about the pandemic. So here is our potential symptoms ones. What we've tended to do now, given things are changing, is started to put dates on them and then put a little asterisk saying, for latest information, go here, or saying that things might change with the new variants of concern. But this just showed the different symptoms that people might have, and reasons for people to go and get tested. We've done one on transmission, so explaining things like airborne transmission, explaining how this is you end up with super spreader events, things like that. We've done this one here is explaining how the tests work, and so what the serology tests are looking for in terms of looking at antibodies versus PCR tests looking for the RNA of the virus. And again, we've taken everything we can from publications. We try and reference everything where we're doing, where we've got our information from. So trying to provide the scientific information in a much more, in an engaging way that gets people, talks people through the science. And one of the reasons we're able to do this is because Toby's not a scientist. He's a visual thinker. So his job really, my job is to explain the science to him, and then once he's understood it, he'll come up with visual ways to represent that. This one here shows, and it's an explanation of the variants of concern. So how does this virus, how do these variants arise? And the idea that Toby had was showing how, the genetic code is a bit like a bicycle lock. And so we have these little rings that change, and how those changes then turn into different amino acids, and how that changes how the virus behaves. We've also done vaccines. This one here was for a New Zealand audience, because we're using the Pfizer vaccine here, and so we step people through exactly how this, how the technology works, and how the vaccine works. We'd also done some little fun ones. So this was alternatives, so non-contact greetings, alternative to handshakes, hugs and high fives, different sort of ways, and lots of these are sort of animated slightly, so the little figures move. We also did one that was quite popular, which had an explanation of some of the words that scientists use that have different meanings in everyday situations. So this was a series of words, but was ultimately in New Zealand to explain what elimination meant. So whereas, elimination to a normal audience, pre everybody becoming an epidemiologist, I think everybody thought that elimination meant to get rid of something completely. And so what we did with this graphic was to show that elimination meant to remove something from an area, or to get it to very low levels, whereas to remove a virus completely would mean eradication. The picture on the screen is showing what the word model means. So showing that by model, that's normally a small replica or a person who demonstrates clothes in everyday use, but to scientists, it means the simulation or representation of the real world. And what I like here is that we've put that formula there is the modeling that was used to give the government advice in New Zealand about how our population would be impacted by COVID-19. Here in New Zealand, we used the concept of bubbles to talk about households, and so when there are cases about staying in your household to prevent transmission. And so very quickly, as soon as that term came into, in fact, as soon as we heard the Prime Minister mention that term for the first time, we started doing a series of graphics that explained to people what bubbles were, how you had to stay in your bubble, and if you left your bubble, you might end up popping it and popping somebody else's bubble. And then this is one of my favorites, was to explain this Swiss cheese model of, so to show how different countries are using different interventions to, to protect people from the virus, and what these are. So some of them might be border closures and border controls, the strategy of test, trace, isolate, explaining what lockdowns were, showing how some of those controls are government controls, and other controls are personal controls. So things like washing your hands, staying home if you're sick, getting tested, wearing a mask. So explaining to people in New Zealand what were the slices of cheese that we're using here, and how different countries are using different slices depending on their situations. We've also covered misinformation and disinformation. So actually that the original graphic that you saw, I think that was in Shamila's slides, that came from us, was an adaptation of our first graphic about showing exponential spread. So we've covered explaining to people the difference between misinformation and disinformation, and just trying to get people to think about where their information is coming from and whether it's really worth sharing it. So our aim really has been, or my aim has been, to be independent of government. So I don't sit on any kind of government advisory boards, but to be able to provide the public with whatever information that essentially the government has access to provide that in bite-sized and understandable pieces, and to make it engaging and shareable, and then through the Creative Commons to make it able so that others can actually adapt that, whether it's translate it or adapt it in other ways so that it's suitable for their situation. And so it was absolutely fantastic when Toby was then approached to start doing things for the WHO. So taking a lot of the graphics that we had first tried out here in New Zealand, and then adapting them for the WHO. And it's been wonderful to see them translated into so many different languages and built on in lots of different ways. So if you're interested, there's on the Spinoff website, we have what we call our bumper box set. So we have a page that pulls all of our graphics together. There are about 40 that we have now. We explain things like contact tracing, as I say, the variants, transmission, vaccines, all of those kinds of things. And so we put all the new ones here as we build them. And so with that, I think I'll finish. That's given us plenty of time for questions. And as I say, thank you so much for giving me this opportunity to talk about what we've done. It's, as a scientist, been absolutely amazing to have this collaboration with Toby. You know, as a scientist, I always hoped that my research would have some impact. And it's been really interesting that actually it's been the science communication that I think has been where my career will have had some impact. And that was really just the sort of passion for science communication and working with other expert communicators to get information to people so that they were, you know, fully informed. Thank you very much.
Thank you so much, Susie. And there's lots of comments in the chat thanking you for sharing your graphics. And for us personally here at WHO, it's really nice to kind of go back in time and see really how many of the concepts that you and Toby worked on we used here as part of our communication. So thank you for that collaboration. It's really been nice. And it's also really nice to see science and art come together. That's a rare and very magic spot. So thank you for sharing that with us. So we're going to move on to having a short discussion with you and Vish and our audience. We have a couple of questions ready for you. First, let's go back to Vish. And for decades, your work has really focused on engaging communities and also young adults through science projects. What did you learn from those interactions, and how can we better make science accessible and relevant to everyone?
Sure. I think this point was made also earlier. I think you don't want to start your engagement with a community under an emergency, right? You know, so community engagement by definition is that you have been working with the community over a period of time. So when things like emergencies come across, you know, you're able to pivot yourself very quickly because you're hearing from the community. So the first lesson is, I think, you know, we acknowledge that the expertise is diffused. We may have, as scientists, expertise in terms of technical information, but when it comes to the culture, the context, the local conditions, it is the community that has the expertise, or the community partners. So right from the beginning, we acknowledge that there is expertise there in the community, number one. Number two, I think when we come to defining problems, we always define the problems from our perspective as scientists or agencies or institutions. My point is that the core definition of problem is as important as co-production of solution. I think at the community level, they know how the problem can be defined and seen, and is seen by the community. And that will automatically lead to different kinds of solutions. So Dr. Wiles was showing the infographics, and we created a number of these infographics, you know, and frequently asked questions. All of our myth busters and frequently asked questions are all based on this kind of engagement from the community. But the point there is we keep iterating constantly, right? And that iteration is again an acknowledgement that the community partners are reacting to it. So, you know, I have seen a couple of comments. It's very difficult to do it under emergency conditions, but you know, if you already have an existing relationship right from the beginning, and there are some great examples now, you know, the National Academy of Sciences is actually organizing an entire session on this science communication and engagement, because we realize that that's the only way to do science communication effectively is this kind of engaged science communication.
Great, thank you. Thanks, Vish. Susie, your flatten the curve graphic that you shared with us in the beginning of your presentation really resonated around the world. I think we kind of maybe know about why, but why do you think? Were you surprised by that? And why do you think it resonated so well? How did it speak to people so clearly?
Yeah, so lots of people have written about how our version was sort of like the version that really made it take off. And I think that was partly because it showed us as individuals how we can act. To be honest, it's my greatest regret of the pandemic was actually being involved in making that go so well, because just a few days later we made another version which was pushing the elimination message. So it was showing how actually you didn't have to flatten the curve at all. You know, if you could try to get cases down so that you could stop them, then that was best. But it was also about how, and so we changed the sort of one person to a group of people. We talked about strong collective action. And then the final, so it was this one went, it had 3 little things that it toggled between. So it had the first one, just like in Flatten the Curve. It had the second one, which was showing the elimination. And then it had the third image, which was if you took your, if you stopped that collective response too soon, you would see the cases come back. And we released that 5 days after Flatten the Curve, and it didn't go viral in the same way. And I wonder whether more people might have understood then the importance of stopping transmission rather than just slowing it down. But there you go, that you can't control how the internet deals with things. So yeah, I guess while it's the thing that brought Toby and I together, it's been almost my biggest regret.
Oh, that's interesting. I mean, sad to hear, but now I understand completely as a communicator how that goes when you start with something that takes away a lot of attention from what you may think is the more important factor to focus on. So thanks for sharing that observation. Vish, we have struggled with something here at WHO through our headquarters, regional, and then country level, and that's how to better reach individuals in rural areas. You started off your presentation with the fact that 50% of the world's population is now on social media. That's only going to grow, but then that means 50% of the population is not on social media. And I know that we've quite struggled with how to get information out in a relevant way to those individuals. At the same time, we're trying to get information out more quickly, frankly, through social media. So what are your thoughts on how we can improve upon that? And then, well, I don't want to say the next go around, but in the future.
Yeah, I think there is certainly a certain amount of technological determinism in much of what we are doing and saying here, that somehow internet and social media and new technologies can solve a lot of these issues. But as I showed in one of my graphs, I think about digital discrimination, I think this is a huge challenge. And also I often see, people putting stuff on Twitter, right? We are all on Twitter, but we are all speaking to each other. Real people are not on Twitter. That's not what they're doing. So the question is really, how do you do that? Our own experience is we find the partners. That's what I meant by acknowledging that the expertise is much more diffuse than we think it is. The decisions should not be made in Geneva or in Washington, DC, or in Boston, or in New Delhi. But the decisions could be made at the regional levels, where if you find the appropriate partners, and that's what we have done, we find the right partners and we work with them, and we learn from them. We have really learned a lot from our partners who tell us very, in a straightforward way what works and what doesn't work. So in rural India, for example, now we have figured out one partner who actually works with rural healthcare workers. We don't do that sitting here in Boston or in Mumbai, where our center is. So the challenge is, really finding the right partners, and they're outside the government, to be very frank, right? A lot of civil society organizations are doing this work in urban and rural areas, and working with them is what we have found to be very effective, because we also can't run randomized controlled trials on our infographics when we create them, right? It's not easy to do it, but how do we know that our infographics are working? And one way to do that is doing these kinds of working with the partners and trying to collect some feedback and information on that.
Great, thanks, Vish. So Susie, I'm going to go back to you. And recently I did an interview, and a lot of the interview talked about really what the science of trust is. If you had to do a graphic around science and trust, or the science of trust, how might you visualize that?
That's a great question. So I guess my cheat answer is that I'm not the one who visualizes things. That's Toby's job, being kind of visual person. But that's a really good question, because I struggle with this a lot, because we've been talking a lot about disinformation, and around the world we've got scientists and medical professionals who disagree with the approach that this is, the pandemic is serious and things like that. And so it's hard actually to say trust us when not everybody's saying the same thing, right? So for personally, what my approach has been, you need to understand my values to understand the lens through which I evaluate evidence. And so that's just something I've talked about a lot. And I wonder whether that's something that's important too, is what is the underlying values of the person who's communicating, and can you understand what their agenda is? Because I think that's really, really important. When you can understand, where you can see where the agenda is coming from, that can help you understand whether that is somebody you would want to trust or not. But it's a really great question, and I think it may be something that Toby and I should start thinking about.
Great, thank you. So Vish, I'll go back to you. One of the things I think we've been maybe challenged by, I think most communicators are, but particularly on something like this pandemic with such a global scale, is really on how to better measure what we're doing and seeing whether or not it's resonating with our audiences and it's meeting our intended goals of, in many cases, changing behavior. We're coming very much from the global level, but also work quite a bit with, regional and country offices and partners. But, seeing what you're seeing and having the experience that you have, what are your insights on how to really better evaluate and measure the impact of what we're able to communicate during this pandemic?
So to me, this is arguably the fundamental question as well as an empirical question, I think, So as I said earlier, and I was not being trivial at all when I said we can't run randomized controlled trials, we don't have the luxury to do that, So one is, really drawing on the science, right? Mindy, more than anybody else, as much as anyone else, that we have a very good body of communication science literature, which tells what works. We almost have 40, 50 years worth of work, and we know what works and what is not likely to work. I think, so that's where we start. We also start with the community. But the issue is, trying to really be very creative in the way we collect data. I think, the challenge, I think, with data collection is most of us have been trained in really this top-down survey, in a very systematic way approach, which is great, and I'm completely for it. But at the same time, under emergencies, that's very difficult. And that's where I have said before, working with your partners and really constantly, talking to them, engaging with them, and finding out what is working or not working in the communities. That's how we are collecting all the information right now, because we don't have the luxury to do this kind of measures of impact and effectiveness. So we actually work with key informants and key partners and collect information from them to figure out, if these graphics and these dashboard we have created is working or not. The second thing we have done is using something like, ecological momentary assessment. You can actually, through cell phones and others, now mobile data are quite have penetrated quite a bit. Mobile phones, you can do 1 or 2 item surveys, or as you know this as ecological momentary assessment, and you can actually do that. You don't need extensive infrastructure and setup to do that. It's kind of it. The last thing I want to say is, I have said this before, we need to create, and WHO potentially could take a lead on this, a communication surveillance network. Just as we have a disease surveillance network, we need a communication surveillance network so that we don't have to worry about these things under emergencies, right? If we can do that, that will actually help in times of emergencies to collect data, to test out material very quickly, and iterate very quickly, I think,
Just as you said, WHO should take a lead on that. I heard pens clicking and notes writing around the room, so duly noted. I have another question, just simply about message testing. I mean, prior to this emergency, we would, do quite a bit of work with building capacities at national levels. And I used to say, listen, any amount of message testing is better than no message testing. But you coming from 2 different angles, I'd like to just hear your perspectives on how and if you've been able to do this very quickly, maybe some strategies that you've used, and just how have you incorporated that into your work? Maybe I'll start with Susie and then we'll go to Vish.
Yeah, so we don't test anything. We kind of just, so Toby and I obviously work through things together, and then, and sometimes that will go, sometimes things will go back and forth for a little while. We have a few other people that we show things through, but we don't. Usually that's because there's a real like, oh, this is what people need to understand right now, so we need to get this out right now. So we try and do things fairly quickly. We've had ones where we've modified them a few times. So we're like, oh, okay, no, people didn't get that bit. But yeah, so that's something that we, it's just, it hasn't worked in our time frame and we haven't had the capacity, right? And it is sort of contrary to everything else, but we very much, the two of us have just gone kind of on gut instinct, really, based on, I guess, my understanding from the questions that I've been getting from journalists or the questions that I've been getting from the public, you know, what's the thing they need to know right now and how can we explain it? And then based on Toby's, you know, immense knowledge and his expertise as that visual person is, you know, what's the way that he thinks our audience will understand it. We know, though, that, you know, we're not going to, our work's not going to be relevant to every audience. And that's also why it's Creative Commons, so that others can take the concept and make it right for them, because we can't do something that's going to be, you know, perfect for everybody.
And Vish?
Yeah, I think from our perspective, one of the principles we operate by is that do no harm, right? So we want to make sure that our messages are not having the unintended effect. So take fear, for example, right? We in public health are strong believers in negative emotions, such as fears. We are public health schools, right? But we also know that, number one, it leads to unnecessary stress, particularly, and in fact, stigmatization, right? So, and we have a lot of incidents and anecdotes around that, when we stigmatize. Our frontline health workers have been attacked by people, because of fear, I think. So we have to be extremely careful in what we communicate and how we communicate and what kind of messages we use. So the first thing we want to understand is do no harm. And second is, are we being effective? So one of the ways we have done is under non-emergency conditions, we have done a number of field experiments. So we have learned a lot. For example, we ran one experiment for emergencies under non-emergency conditions where we tested facts versus narratives. And we have been able to freely draw from that finding, where people are biased towards narratives. That's a conventional wisdom, but facts work very well under emergency conditions, actually, better than narratives in some times. So that we draw on that, number one. Number two, because we cannot do experiments under emergency conditions, we start talking to people. We try to collect data from different places. What is being downloaded by people from our dashboard? Who accesses our dashboard? Plus, so we're constantly monitoring that. And then we are talking to the partners constantly to say what is working, what is not working, and what else do you want us to do to change what we are doing right now. That kind of agility, again, is coming from the audiences. We are trying to reach out through partners rather than from us. So you take the chat, for example, today, and the kind of questions that are being asked today, right? That's an excellent source of intelligence, if you think about it, right? You have to take advantage of these kinds of, from all over the world, we are hearing from people, right? I mean, where else can you get this kind of information? Even though we are not talking about representative sampling here, but these are people who are engaged in these issues, right? So that's, you have to be very agile and very creative in collecting this data, but constantly be sensitive to the fact that you don't want to, you want to not only be effective in your messaging, but also not do any harm.
Great, thank you, Vish. I think we've actually also followed that rule of thumb over the course of the past year and a half. I'm going to continue because we have so many questions to ask. So we'll continue with this question and answer for another 5 minutes, and then we'll shift over to our next keynote speaker. So the next question we have for both of you is, how can we better counter mis or disinformation from other scientists? Do you want to start, Vish, and then we'll go to Susie?
Sure. I think this has been a big challenge. I think, especially as I said, in a 17-month environment when the science has evolved so much, the scientific debate is not uncommon, right? In science, whether it is obesity, whether it is fat, whether it is physical activity, there are always disagreements, number one. I think the part of the problem is, I think all the disagreements are happening in public in a very compressed timeline. I think that's a problem. Usually there are consensus guidelines. There is an epistemic consensus, as somebody used the phrase. There is a consensus, and you are able to actually say, here are the facts. If you go back, I mean, you were involved in this. One of the best examples of science communication was during SARS, when Rick Besser went up and said, from advice from all of you, went up and said, this is what we know, this is what we don't know, right? That kind of a transparency and credibility and trust building has taken place. At that point, I think, even there is a scientific debate, I think, you are listening to the authority, I think, and that's one way to counter it. What happened this time around, and I will stop after this, is politicization of the science. It's science interacting with politics, including our politicians. I won't go into many specifics here. I think that has amplified the scientific debate. Usually scientific debate is in some corners of professional journals and professional societies, right? But because of politicization, it has become amplified, whether it's hydroxychloroquine, and I won't go into, why, but so what happened is that kind of a disinformation became amplified and mainstreamed, and that has created problems for us here.
Yeah, I agree. This is, I mean, it's been really, really hard. And I've been pitted against certain people here in New Zealand who, and it's very hard. The thing that I've just tried to say has been to point out where people have been cherry picking evidence to try and explain, as Vish said, what we do and what we don't know. And when somebody's being so certain, that's a clear red flag, right? When we actually don't know. And this come back to this idea of values and agendas. So what are people's values? What can they tell you about what they believe in? And what outcome they're trying to see? I think that's kind of how I've dealt with it, really.
Okay, thank you. And this will be my last question. As we continue with the COVID-19 response, we're also beginning to really think about how to better help countries prepare and be able to lean forward in terms of their readiness for the next emergency. What might be your advice when it comes to information and the sort of the knowledge ecosphere around this that countries could work on now to better prepare for the next emergency? What could they be doing differently in the future? Maybe Vish first, and then Susie.
I'll let Susie go first this time.
Okay,
sure. I mean, I guess from a scientist perspective, I think it's really, really important that we change the incentives around science and academia. That my career has been, wanting to learn how to be a better communicator, but actually it's not been incentivized. And many times in my career, I've been told to stop doing what I'm doing because it's not the thing that will get me promoted, or it doesn't contribute to papers or whatever. So I'd like to see a bit more support for scientists, actually, that communication of our research beyond a peer-reviewed journal should be encouraged. And people should be nurtured to do that kind of thing, because as several people have said, it's when you are communicating, and it's a two-way thing. It's not just talking at communities, but when you're actually properly communicating with different communities, and when you're building those relationships and that trust during times that aren't in crisis, that's when you then have that trust there and you can, step it up. So I think that's from the science and the journalists and all those kinds of, those relationships need to be being made, and that kind of behavior incentivized.
So thank you. That was wonderful. I think, so we actually have a manuscript coming out on this. So one, I think building both capabilities and capacity among nations, right? Both the skills and the bandwidth, the capacity. One, I think WHO can, forget the headlines. WHO has the reach and the credibility in many countries. And I think that's one thing, capabilities and capacity. Number two, we act as if the private sector doesn't exist. We have to bring the private sector to the table, not just social media platforms. Of course, we are doing that, but other companies and corporations, because they have a tremendous role to play, whether we like it or not. Number two. Number three, I think, engage science. As I said, I think, Susie was just saying that, we have to engage communities and partners right from the beginning, not during emergencies. Number four, I think philanthropy. We have to bring philanthropy partners, again, to bring them on the same page. And number five, I would say, reiterate the fact that we do have to create this kind of a communication surveillance network where we can continue to collect data frequently and share the data back so that people can make evidence-based policy decisions.
Great. That's some perfect advice from both of you. And Susie, we're very thankful that you decided to buck that chain and really increase your skills in communication. It's served the world well over the past year and a half, as has your work, Vish. Thank you so much for your time. We're going to move on now to our next keynote speaker, Dr. Alexandra Freeman, who is the Executive Director of the Winton Center for Risk and Evidence Communication from Cambridge. She specializes in trying to produce informative but not persuasive information to help decision makers. Alexandra will be presenting today on trustworthy and useful evidence communication to decision makers. Alexandra, welcome.
Thank you very much. And I shall also now try to share my screen. And what an amazing lineup of speakers. I've really enjoyed listening to everybody so far today. And thank you very much for inviting me to be part of it. Hopefully you can now see my screen and hopefully you can hear me fine. So the Winton Center was founded towards the end of 2016, and we study how best to communicate evidence, particularly numbers, in a whole range of different contexts, not just healthcare. But as you can see, our motto there, to inform and not persuade, is, I think, the key thing that I want to start with today, because it's a difference between communication aims that I hadn't really appreciated in my previous career. I used to be a documentary maker for the BBC, and I always thought that I was informing. But actually, I've come to very much realize that I wasn't always doing that. In fact, I always had a story to tell. And I think that's one of the key differences between informing and persuading people. Now, this is, of course, a spectrum. So at one extreme, on the inform end of the spectrum, we've got things like informed consent in medicine or presenting forensic evidence in court, where I think we'll all agree that the job of the communicator is absolutely to inform people and not to try and push people to a particular kind of belief or behavior change. And at the other end of the spectrum, at the full persuasion end of the spectrum, you've got pure marketing and PR. And I think we can all see that that is absolute persuasion. And where public health lies in that spectrum, I think, is a really interesting question, particularly during a public health emergency. If you're communicating to decision makers, as in the title of this talk, I think I'd suggest that you're probably towards the inform end of the spectrum, because it's the decision makers who should be making the decision based on the information that you give them. But you might think that decision makers sometimes need simple, clear instructions to follow during an emergency situation. So I think there is a real debate to be had around this. And I hope that during this talk, I can ironically persuade you that pure information is certainly something that public health communicators shouldn't be afraid of giving. And the really interesting thing, I think, between informing and persuading is how it changes the aims of your communication. Do you want people to understand the information, or does it really only matter that they believe it? Do you want them to be better informed, or is it more important that they change their behavior without necessarily understanding completely the information behind your advice? And all of this makes it much harder to measure the aims of informative communication. If your aim is to get a message across or to change people's behavior, then it's much easier to measure the number of people who've done a particular thing or believe a particular thing. Whilst if you're just trying to inform people, then actually that's quite difficult to measure your success. And I think there's also an important difference in your attitude to trust. So what we say we do at the Winton Centre is to work on demonstrating trustworthiness through your communication. And it's not just the same as wanting to be trusted. So that's why this talk is on trustworthy communication and useful communication. And I think it's also important to notice that for decision makers, that can be individual decision makers, such as the public, not just policy makers. So I'm going to give a whistle-stop guide to a few key take-homes. So number one on our Winton Centre checklist for trustworthy communication is giving balanced information. Here's an example. This is a tweet from the UK's National Health Service about COVID vaccines. And if you have a look at it, does this contain all the information that you would need to make an informed consent-style decision about whether to take the vaccine or not? Would you expect this kind of information if you're about to get knee surgery, say? Well, clearly not. It's a classic persuasive message. But you might say that's how it should be for public health messaging. And you might be quite nervous of giving people messages that actually say that the vaccines aren't 100% effective and they do have side effects. So here's an example at the other end of the spectrum for that same piece of information. This gives people the full information on the benefits and harms of a particular COVID vaccine. And this format's called the fact box, which we and others have long shown that helps people understand and remember the information in it, this kind of tabular format of the potential harms and the potential benefits. But I think most of you would say that this amount of detail on potential harms might put people off having the vaccine and might be an irresponsible way to approach communicating about the vaccines. But we've actually tested this format, and despite people's concerns, it actually improved people's feelings of being informed about making the decision, but didn't change the decision that they made in the end about whether to be vaccinated or not. So your instincts about what people would do when given information might well be wrong. These things have to be tested empirically to find out. This communication is an empirical science, as we've been hearing. And so I'm quite unashamedly going to be giving you quite a bit of evidence-based and sometimes having graphs in slides about this. But balance is more than just giving people numbers about harms as well as benefits. Numbers don't make sense on their own. And as I said, at the Winton Centre, we specialise in giving numerical information. If I told you your risk of getting a certain type of cancer in your lifetime was 14%, say, that wouldn't mean much to you. You'd want to know, you'd ask me, is that high or is that low? You'd want to know what that number meant in comparison to other things. And choosing that context, those comparisons, is really a vital part of getting balance. I'm going to give you a couple of examples. So this message was released at a UK press conference on a Friday in 1995. It simply said that the potential harms from the new contraceptive pill would double those of the previous version of the pill. It was already headline news by lunchtime and throughout the weekend, as you can see from the magazine cover there. But the only comparison and context people were given for that number, for that risk, was the chance that harm had doubled. That doesn't tell them anything about how big that risk really was. And this was the result in the UK over the coming months. So clearly this information had a really dramatic effect on people's lives. They were making decisions based on it. But this is how big those risks really were. 1 in 7,000 per year had doubled to 2 in 7,000 people per year would get this venous thrombosis, this blood clot. And put like this, I think a lot of people would probably have made very different choices. with very different life consequences. We wouldn't have had panic and people coming off the contraceptive pill. So it's not just about numbers, it's about the flavor that we give them, about those emotions that are surround numbers, and how the context that we put around them changes our perceptions of them. And here's a case that goes in the opposite direction. This is the aftermath of the infamous L'Aquila earthquake in Italy that killed hundreds of people. And you may remember that 7 people were convicted for the way that the evidence was communicated around the possibility of this earthquake, or possibly not communicated. The local people were reassured and told not to worry, and the chances of an earthquake were very low. And that was true. The absolute probability, the chance of that earthquake was always really low, about 0.1%, I gather. But it was something like 100 times higher than the background probability in that region, because there'd been some earth tremors. There was seismic activity. So although no one's arguing that there was an evacuation should have happened, also reassurance shouldn't happen. People in this case should have been informed more than given a message, a persuasive message about how to behave. So how does this translate to instances like COVID? So when communicating evidence to help people make decisions about COVID, we need to think hard about the context we're going to give people. We need to think, if we're giving them a number, is this out of how many, compared to how many? Has this increased or decreased from what? So in this example, we were tasked with helping people understand their risk from COVID. The absolute chances of any one person having a serious outcome from COVID is very low. They've got to catch it and then be vulnerable to it. So giving them a number on its own would be fairly meaningless. What can we do in the way of context then? Can we give them something relative? Relative to what? You can't give it over time. This is a new risk. Your chance in December 2019 was 0. Everybody's was. Relative to other causes of death. Well, that's quite a common one. People often say, you know, I can give your COVID risk relative to the chances of seasonal flu, say. Are those helpful comparisons? Or what about relative to another person's COVID risk? But whose? Would that be helpful? So we talked to people and found out how they thought about COVID risk. And we found that people actually have kind of mental models of what high risk and low risk of COVID look like. And they look like other people. So this comparison with other people was helpful. And so we built this kind of a scale, which is called a risk ladder, that helped translate what people's mental images of what high and low and medium risk might look like in terms of people and personas into numbers. And then we can put a little arrow on the other side that says your risk, and then people can see where it is in comparison. And for the people that we spoke to and that we then did surveys of, this was more helpful than, say, comparing their risk from COVID to their risks of other diseases, because people saw COVID or felt COVID was very different from, say, cancer, and certainly very different from winning the lottery. It's a very different feel to the risk, and that's what you need to be aware of. And here's another example. We were asked to help communicate the risk of a blood clot from the AstraZeneca COVID vaccine. So again, what we had to do was think about what is the decision that people are making, and therefore what's the useful way to give those numbers context and comparisons. So here again, we're giving the absolute numbers out of 100,000 people. You can see the absolute numbers of people getting a blood clot related to the vaccine. But on the other side, we want to show the other side of the coin, the potential benefits. Or you could think of this as the harms with and without the vaccine. So again, it's giving the absolute numbers, but also giving a sense of the relative risk and matching the feel of the two things you're giving people to compare. So all this is about giving balance. But when it comes to giving balance, it's not just what numbers you give people, it's how you present them. Again, we've talked about this already today. And there are so many effects, which others have mentioned here, about framing, that kind of thing, that I could talk about. But I wanted to give one more example from our work, which is particularly about communicating numbers, and the way that you present them can have a big influence on perceptions. So we showed people a randomized series of risks just numbers, 5%, 12%, 20%, there were others as well. And we gave them a little slider and asked them how risky each of those felt if it was your chance of dying from COVID-19. And the first group saw the risks as percentage chances. Here you go, 5%, 12%, 20%. And you can see here, this dot shows on this vertical slider where they felt that risk lay on average. The next group were given that number as out of 100. So 5 in 100 people, 12 in 100 people, 20 in 100 people. It's the same numbers, but now they felt it felt a little bit riskier. They, on average, put the little slider a bit higher. And then another group were given that chance of dying as 1 out of X people. So 1 out of 20, 1 in 8, 1 in 5. And you can see these felt much riskier to people. So the way that you present numbers is also really important, the format that you put them in, for getting that balance. You have to be aware of these kinds of effects. There are other reasons why I wouldn't advise putting 1 in X as well, because it makes it very difficult for people to compare things. So that's balance. My next take home is dealing with uncertainty. And again, we've talked about this a little bit already today. Here's an example that's outside of the COVID from my old employers, the BBC. But this is a classic kind of headline. You've got a number falling to another number. And this was a big story back in the days where unemployment was falling. And you might have already started having a look and going, it falls by 3,000 to 1.44 million. That's not very much, is it? So you might actually want to check out these figures, and they come from the UK's Office of National Statistics. And if you really dig around on their website, you can find out that that number was 3,000 plus or minus 77,000. So unemployment may have gone up, it may have gone down. We simply can't tell from the statistics that month. And so the uncertainty around this figure was really key to the story and key to how much faith people should put in it. That headline was not justified by the numbers. And if you're giving decision makers numbers that they've got to weigh up in their decision making, it's really important to them to know how certain or uncertain that information is. Is it an estimate? Is it an actual count? How much might it be out by? And when we say this, people often say, but communicating uncertainty confuses people and it might undermine their trust in the numbers, or even worse, in us as communicators. And this is something that we at the Winton Centre have also been doing work on. And so we've been presenting people with statements about, for instance, in this case, COVID again, giving them numbers, so a 17% here, either with no uncertainty, or giving them the range, so between 10 and 34%, or just indicating that there might be some uncertainty by using words. And we've done this experiment in 12 countries, over 10,000 more people, and we measured and asked them about how much they trusted the numbers and how much they trusted the communicators, and we also tested how much they understood them. And the reassuring thing is that actually it made very little difference at all to people's trust in it. Slightly decreased the trust in the numbers, as indeed it almost certainly should do, but made very little difference to people's trust in the providers of the information. And it didn't confuse people either. People are fine with being given answers, especially with a numerical range, that have uncertainty around them. So I would say be upfront about your uncertainty. But there is one kind of uncertainty that's a bit different, and again is really important in these kind of emergency situations, and that's the quality of the evidence. We've already talked about how low some of the quality of the evidence is, particularly early in a pandemic, when there's scientific disagreement, there isn't research, we don't know that much. So we started doing some research on this, again looking at public health interventions and giving people information about the chances of getting COVID with and without this kind of protection. And we did an experiment where people were given a label as to the quality of the underlying evidence. Some people were told that it was low quality, some people were told it was high quality, and some people didn't have a label at all. And what we found that if they were given the low quality of evidence label, they trusted it less. That's kind of as you'd expect than if they were given the high quality label. But I think the important thing is if they were given no indication of the quality level at all, they seem to assume that it was high quality evidence. And I guess that makes sense. If somebody's telling you something, you assume that, especially if it comes from a source that looks trustworthy, that they actually know what they're talking about, that the evidence is high quality. If it's not, and sometimes we know it's not, as communicators, I think it's really important for us to acknowledge that, because we now know that people who are making decisions based on that, the quality is really important to them. If it's low quality, they think of the chance, they think of the effectiveness of the intervention as being more in doubt, and they're slightly less likely to take that intervention, and they think it's slightly less effective. So it may undermine your public health message, but it's not necessarily completely honest not to say that the quality of the evidence is low. So I think it's really a helpful checklist for people to think through what Professor Sir John Krebs said when he had to deal with a lot of public health emergencies in the UK. And that is to say what you don't know, say what you know, sorry, then say what you don't know, say what you're doing to find out, and what we can all do in the meantime to be on the safe side, and make sure people realize that the advice might change and when and how you're going to update it. And this, I think, has been the playbook for many of the most successful communicators in the current pandemic. So we've been looking at the effect of putting all these guidelines together, being balanced, being open about uncertainties, and also preempting misunderstandings, which is another key aspect of it. And I think you might all be starting to worry that if you did all of this in your messages, then it would undermine people's interest or faith in them. It might undermine the way that people respond to them. So I'm going to just give you a sneak preview of one little result, which I think is tantalizingly showing us that this may not always be the case. So these aren't published, so all the caveats with not yet published research go with this. But we put all of these caveats, all of this trustworthiness into messages about the COVID vaccine and compared it with typical text from the UK government about the safety and efficacy. And as in our previous studies, first of all, there was no difference in people's intentions to get vaccinated between the two of them. But when we looked at people who had come to that message with an initially negative view about the vaccine, compared to those who had an initially positive view about the vaccine, we found something really interesting. And again, these are preliminary. We're hoping to replicate it. But you can see that people, so the red bars are the trustworthy message with all the caveats, and the blue bars is the typical message with no caveats, no uncertainty. For people who had a positive view of the vaccine, these tall bars, they trust the information, they trust the producers, they think it's high quality and they're very engaged, and nothing we changed in the message changed that opinion. But for those who were slightly skeptical about the message in the first place, they trusted it more, they trusted the producers of the information more, they perceived the quality of the evidence behind it higher, and they were more engaged when all those caveats were in it. So I think that's just tantalizing evidence that maybe being truly informative and not persuasive might actually be a good thing to do when some of your audience are skeptical. And this is my summary slide of the things that I would say are our take-home messages. And I've got a little checklist for those of you who want it, which I'll put in the chat. And I'm very happy to share that with all of you. Thank you.
Thanks so much, Alex. And I have to say, it's pretty comforting to hear your recommendations and know that we've been pretty much saying that and working with those points all along the response, but also prior to that, working with our member states and guiding them in their communications response as well. So thank you very much for presenting that and the latest research as well. So we're going to move on to our last keynote speaker, and then after that, we'll have another discussion between Dr. Freeman and then our next presenter, who's Dr. Attila Imarino, who has a PhD in microbiology. He was the co-creator of Science Blogs Brazil, the Portuguese branch of the largest scientific blogs network. Today, he's a science communicator on YouTube with millions of subscribers and viewers. And he's gained notoriety in Brazil for communicating about the COVID-19 pandemic on social media. Attila, welcome.
Hello everyone. Nice talking to you. Can you hear me well? Yeah. So
yes,
I'll try to share my screen here and the presentation, and I'll be right back. Okay, so it's a pleasure to be talking here. This is the presentation. I'll try to be quick on the introduction. I just wanted to talk about what's happening in Brazil and how we communicate science in an environment with very much disinformation, misinformation, lots and lots of COVID cases, and not so good perspective on how the pandemic is going on, especially when there is no present public message from authorities about COVID and prevention and everything else. So I'll make a quick introduction on my trajectory, just to show you that engagement and community building has to be done for a very long time before you can reach loads of audience. So I started my PhD in virology in 2006 on HIV evolution, mostly to share about evolution and biology. I started a science blog that became a Science Blogs Network in 2009. Then in 2011, I started making participations in podcasts about science, and that's when I figured out that doing audio and video may reach a broader audience and way more people that wouldn't know about science otherwise. Then in 2012 to 13, when I finished my PhD and started my postdoc, I think I was resting too much, sleeping too well, and decided to start a YouTube channel on science and science communication, using pop culture to reach a broader audience, especially youth, to talk about science in their everyday culture. And then it grew so much to a broader audience, to many people, that I jumped boat to science communication professionally in 2016. So unlike, I would say, most presenters here, I've been doing mostly science communication and no research, at least since 2016. And that's where I was in 2020 when COVID started. And I knew that because of my background in virology and in science communication, I had to talk about COVID to Brazilians as much as I could. So how would I talk to Brazilians about COVID? What kind of information do we consume here, and how to reach people? So I'll use mostly results from the Reuters Institute's Digital News Report. That is one of the very few venues that investigated how Brazilians consume information, mostly science and mostly news, but it may be extrapolated to information in general. So Brazilians mostly consume local news about Brazil, not as much international news. At least according to the Digital News Report, it's the country that consumes the most information about itself and not as much about anything else. So it's very hard to use information in English here, to use examples from other countries, from international experience. We have to talk in Portuguese and present evidence in a way that is properly addressed to Brazilians. So Brazilians consume also too much information in video and audio due to literacy levels, media consumption, and social culture. We use mostly video despite data capping from networks here. Brazilians use way too much social media. We have, I think, 98 to 99% of use of WhatsApp on smartphones here. It's people very much have WhatsApp numbers, not cell phone numbers. We mostly like to consume news, to share news, and to comment news in social media, mostly through instant messaging, such as Facebook messaging, Telegram, WhatsApp. And Brazilians consume news mostly online, and at least since 2020, mostly from social media. Even TV, that was still higher up than print media, that is dropping in numbers, is now surpassed by social media consumption, especially from smartphones. And the social media networks that Brazilians use to consume news is mostly Facebook, WhatsApp, and YouTube here. So mostly from audio and video. So, and also Brazilians are one of the countries that is most concerned about real news and fake news, at least according to the Digital News Report. 84% of Brazilians worry if the information they are consuming is fake or not. Mostly they attribute fake information to information coming from politicians and mostly for information coming from WhatsApp. So Brazilians care about real and fake news, care that information coming from WhatsApp and politicians may be false, but when they consume this information, this is the amount of people that prefer partisan media, that want a source of news that shares their political point of view. Brazilians rank as the country that wants the most partisan media, that wants the most information that comes from their political point of view in any country that Digital News Report asks for. So at least since 2013, 3% of Brazilians want information that shares their political point of view, and this is higher even among social media users. So despite knowing that politically motivated information may be false, that information coming from WhatsApp may be false, Brazilians want politically created information and they want to consume it in WhatsApp. And Brazilians are among the countries where Brazil is among the countries with the highest numbers of people that consume information in groups, in WhatsApp groups, with strangers, with people they don't know that are sharing information there, coming who knows from where. So we have all this preoccupation, all this worrying about the quality of information, but the way we consume information is very open to misinformation and disinformation coming from strangers. And the result is that people that consume their information through social media, especially WhatsApp, are among those with the lower trust in traditional news sources, in print media and traditional media, that are more likely to share and use parts of news sites where you can find more disinformation, more misinformation. Facebook, YouTube are taking down videos, are taking down postings, Twitter is taking down posts with fake information, especially about COVID nowadays. But WhatsApp is a special source of information because it's encrypted, you don't know what's being shared, and you can't take down misinformation in there or recommend WHO sources of trustworthy information with misinformation, such as Instagram does. And the information that is being shared there is mostly being shared in audio and video formats. So it's very hard to share written information, to share articles, to share scientific-based information that is written. And it's information, people that consume WhatsApp here, millions and millions of Brazilians that consume WhatsApp, usually have a data plan that has data capping, but WhatsApp doesn't count as data on those plans. So you have millions of Brazilians that can only consume information that is in WhatsApp. You just can't click and share or use or read anything, even a link that takes you out of WhatsApp. So the information has to be in there, in the formats, especially audio and video for people. So we have all these huge informational islands of communities that mostly consume their information from social media. And in this kind of, especially in WhatsApp, there is this isolated information that you just can't reach through any other social media network or traditional media. So when I had to talk about COVID to people, how would I seek them? This is how the youth consume science here. The young students is mostly the public that I was used to talk to. So I was targeting them. This is how Brazilians consume science from 15 to 24 years old, mostly from Google, then YouTube, WhatsApp, Facebook, Instagram. Some read blogs, some use Twitter, not as many listen to podcasts. You'll see no books, no TV, radio, or any other means of consuming information there. So to reach them in Google, when I was lecturing at university, I would use the students to write Wikipedia articles so that they could be accessed to those by those who were searching on Google. So in 2015, when we had the Zika epidemic here, the students from the biology course wrote the Zika virus article in Portuguese in Wikipedia, and it was read by more than 1 million users. So it was a very quick way to reach loads of people. But as I'm not lecturing in university anymore, I couldn't use Wikipedia or institutional sites to produce information. So I would jump to my YouTube channel, where I can make longer videos, lives, very long presentations, lectures about COVID. That's where I would usually be. If I wanted to reach people in Facebook and WhatsApp, those are not networks that I was wanting to spend so much time in, create business accounts or make anything that would take way too much time. So I created a Telegram group where I could share small pieces of videos and audio that people could download in their smartphones and share with their family members or friends through these other networks. And YouTube, at least in Brazil, is one of the beginning points of information and misinformation. So by making YouTube videos, I could also seed new information for Facebook and WhatsApp. Instagram has a particularity. It's where most of the female public is. It's where women consume information about science and health. So it's a social network that I wanted to specifically use to reach this different audience that would not be on YouTube or Facebook. So I had to use Instagram and turn my account into some other source of information of COVID. Blogs, I decided not to spend time writing them just because Brazilians consume mostly audio and video, so I would focus on where people were. Twitter has a particular kind of use here. It's mostly used by decision makers, politicians, scientists, journalists. So it's where I would inform the public the most with scientific articles and information coming from the source. And podcasts, I would participate in as many as I could as a guest talking about COVID, but would not spend my time creating another one and making all this content. So this is an example of how I would share information on Twitter. This is my most shared post on the left. It's where I wrote about a just published paper extrapolating how long COVID would last due to immunity, vaccines, and everything, that it would last at least until 2022 or more, and we would have still some kind of either quarantine or opening and closing for years until we have everyone vaccinated or immune against the disease. And this was way too much shared, burst some bubbles of information there, got me a lot of backlash by saying the obvious to scientists, but when you reach different audiences, it's not always obvious information. Sometimes you're the first one telling them something like, this is going to last, and you have to be prepared to some backlash. On the right, it's a video about masks and some recent publications showing that masks not only helps to prevent people getting COVID, but also helps those that got COVID to have a lower symptom, a less severe disease because of the mask use. So it's a short video with 3 minutes, just because Brazilians like audio and video, that was watched more than 500,000 times. Again, focusing on what will people share, how do they consume information here. And something else, this is a rank of scientists and specialists that talked to COVID and had the highest authority in Brazil, estimated by Science Pulse and IBPAD, the two groups of communication here. And they ranked me high just because I had a huge audience before COVID started, and then it grew because of all the projection. But also the second, third, fourth, and 50th place are also specialists that I was constantly sharing, promoting, retweeting, and pointing the media to, because they are very trustworthy sources of news. So I was very happy to see that the attention I was getting on Twitter, I could then direct it to other specialists and share their perspectives, share their knowledge, and help others to get the spotlight and be the ones informing the population, especially when I didn't want to dedicate as much time and resources to one specific social network. Here's an example of Instagram use. So short videos, short posts with information. Then later I would post on Telegram. The Telegram group is on the right, where people could download it and share it on WhatsApp or Facebook or everywhere else. It's also where I would post the papers and the scientific publications that based the videos, that based the information, so that people could download them, especially when they were open access. It's as I knew that those kind of videos would be shared on other social networks that I couldn't control or know where they would be used, I had to subtitle it, putting my name, my specialization, and the sources of information, just to be careful that people would share the whole package and not only a small cut of information that those that consume don't know where it comes from. it works very well. Instagram is another social network of mine that grew from 100,000 subscribers to more than 1 million subscribers, promoting COVID information mostly. And this is YouTube. It's where I just set my home and where I did most of the videos. I still do weekly lives with more than an hour long explanation. It's more of a class about COVID and what we found out this week, what the numbers are telling, what are the latest publications on vaccine developments or variants of concern or anything else. It's where I would do most of the videos. The most watched videos are mainly from March and April from 2020, when we had barely any information coming from public authorities before COVID really started, and where we'll talk about flattening the curve, what is COVID, why it's spreading, and some lives explaining it. The most watched video was a live when we had in the beginning of March, community transmission of COVID in Brazil. The health ministry made a presentation talking about community transmission and how, due to the virus spread, we could see the failure of the public health system in April of last year. And that's when I knew that they were dealing with numbers and with estimates that were matching the estimates from big studies coming from epidemiological centers such as Imperial College. And this is the live where I explain what was happening, what could happen if we didn't stop the virus. So the numbers, the estimates, how fast the epidemic could spread, the thousands and thousands of lives we could lose if we didn't do enough, and we ended up losing many of those. So this is the live where I say, people, our lives going to change. This is a big change for the whole world, and prepare yourselves, prepare to be at home, to make social distancing, not masks at the time. This is a live that I expected was by 100,000 viewers. It ended up being watched by more than 5 million people. And in the next week, we had states closing, we had cities closing, making quarantine, and some mayors, some governors citing this live as one of their sources of information. So it's worrying and pleasuring, and at the same time to know that you're being watched by them and decisions are being made because of this information that is being shared. Then, especially on YouTube, I would constantly bring specialists to share their knowledge. So historians, demographers, jurists, and clinicians, physicians, to share the information and to show how it's being produced. This led to a participation on TV. One of the most watched interviews of 2020 in Cultura, that is our PBS, was my interview about COVID. It's still one of the most watched videos. This is me talking with the Justice Court of Election here about fake news and promoting fact-checking and information for the broader public before election. And these are the lessons that I take from it. It takes time to build those communities. I had to be doing science communication for years before reaching so many. Consistency is important. If you are using social media, people expect information constantly. Each media demands a specific format, audio and video, mainly in Brazil, but the length and duration of those depends on the social networks. This leads us to cross-media collaboration, participations in TV, podcasts, and everything else came from my social media presence. Others will be inspired. We have many scientists now, journalists, epidemiologists, physicians talking about COVID and citing some of the examples I gave. So it's very important to give these examples. There will be backlash and will be targeted by whoever is wanting to spread disinformation and misinformation. It's something that as scientists, we are not prepared to deal with. We don't know how to present information in a conflicting perspective. When there is disinformation being spread, we always present the facts, but we are not prepared to counter narratives that come in these moments. And we still need public authorities. And when we don't have public authorities helping science to be communicated and promoted, we reach the situation where Brazil is now. We are at the worst point of the pandemic. We have more than 1,000 deaths per day, but Brazil is at the highest points of mobility, the lowest points of social distancing since the beginning of the pandemic last year. Almost a quarter of Brazilians took or are still taking some kind of COVID treatments, bulk treatments that don't work, such as chloroquine, hydroxychloroquine, ivermectin, mostly think it prevents them from getting COVID. So these are people that are exposing themselves thinking that what they are taking is a treatment that will prevent them from getting COVID. And this has some regional and religious concentrations among some groups that use mostly social media to inform themselves. It's especially hard to reach them. And some groups, most Brazilians still trust vaccines, but among some of these groups, there is even the misinformation that when they are hospitalized, they are being hospitalized to be mistreated or to be killed because there are so many dying hospitals here. So when we have this calamitous situation, it's even harder to reach them with the right information. That's it. Thank you.
Great. Thank you so much for your presentation, Attila. It's really humbling to hear about your experience and the reach that you've had and the impact you've had. I think you're truly a proof of concept that trust has to be built prior to an emergency to be able to communicate well with a population. So thank you for depicting that in your presentation. So we have a couple of questions for you and Alexandra. I'm going to go back for a minute to Alexandra's presentation and ask her, how can we better encourage politicians to actually communicate science? I know that when we were doing a lot of our capacity building efforts with countries and member states, it was always sort of that last mile that was difficult to reach coming from the public health perspective. How do we really work with leaders and that voice during emergencies when that person often changes just due to elections and so on? So how can we turn around and help encourage future politicians to communicate the latest science?
Well, I think there's an issue of politicians trusting us as scientists, that if they communicate all the things that I was talking about, uncertainty and potential harms, that won't undermine what they're used to communicating, which is a message. And I think it's just really difficult to get yourself out of the mindset of, I have a message and I want to use all my communications training and background to get that message across. And that to open your mind to the possibility that there might be another way of communicating. And I think the evidence that we and others are building up now about the science of science communication across the whole spectrum of different kinds of science communication can help maybe give people confidence that they're not going to undermine people's trust, they're not going to undermine people's behaviors by trying out these different forms of communication. So I hope that if we all carry on working in this area and build up an evidence base, that might help politicians feel that they can trust us to do it. And we can see great science communicators who are not politicians using these techniques. And here in the UK, for instance, we've seen a lot of the scientific advisors being put at the forefront of the communication from the government to people. And I think that's worked very well. So hopefully that sort of example, which I'm sure has happened in many other countries as well, will lead the way.
Thanks, Alex. And Attila, I see that both you and earlier a presentation from Susie Wiles, that you both really, just under your own drive, really push to be able to kind of communicate the science that you well understand as scientists. But how can we encourage other scientists to do the same thing? It seems like it's really has to be self-driven. It's not incentivized. What recommendations do you have for other scientists to become better communicators?
It's a challenge, a constant challenge here in Brazil of how to incentivize scientists to do their communication. At least here, I would say that this kind of preference coming from financing agencies would be a good boom to science communication. So here in Brazil, doing communication or being present in the media just doesn't count as any kind of productive activity for scientists. So it doesn't count as their evaluation, doesn't count as anything in their careers. Having it being counted as a presence that is important to approve projects, to finance their projects, to finance their research would be a great incentive to make people realize that they have to now focus on the other end of their scientific production, that is communication also. I would say that the financial incentive of evaluating them for their communication or promoting their communication as part of the grants of research would be very productive.
Thanks, Attila. Alexandra, you talked a bit in your presentation about the evidence of certainty, or the certainty of evidence and the quality of evidence, and how people reacted to the communication that sort of was able to highlight that. Being a communicator and creating a lot of the communications you see coming out of WHO, I see that being a bit difficult, but could you give some guidance on how to better be able to do that, to actually communicate the evidence, certainty, and quality as we, provide more information about updated science?
It is really difficult, and we are still doing research into how the different potential forms of communication of quality of evidence affect people. As you saw from the slide where I showed just, quality of evidence equals low or high or whatever, that works for some people and it will work at the bottom of an infographic. But actually, we've also been looking at giving slightly more informative information, such as, not many trials have been done in this area yet, or, this is a new disease, so we don't yet have data from more than one country or whatever. And these slightly more informative labels might be a good way of getting across that certainty without making it too kind of brief and scientific. As I said, we don't know yet empirically what difference all of these different labels make, but the very first studies that we've looked at where we've been putting things like we don't yet have much data or scientists disagree seem to have a similar sort of effect on people. And so I think people do take those cues as understanding that that means that the quality might be low. So I would say just be a little bit more descriptive, perhaps, and a little bit more layperson's terms in the way that you describe what the quality of the evidence is.
Great, thank you. Super helpful. And Attila, how have you been able to well couch uncertainty in your communications with your audiences?
Yeah, one of the points was to try and test information on Twitter. It is a quicker science network, a quicker social media to respond to information. So I would usually spend the week communicating on Twitter, finding out most of the questions people have, what's most important to them before making the hour-long presentation on YouTube with uncertainties and everything else. So it's a good testing grounds for the information I'll present later. And the format that I mostly prefer is the YouTube channel, because I can make an hour-long presentation with the caveats and everything else. So I can explain how the test is being done, how we gather that information, the uncertainties around them, and then give people the final explanation. But I have to deal with the fact that someone is going to cut and use only that final portion of information and spread it everywhere. And I have no control over it. And it's very hard to deal with when you spend 15 minutes talking about the caveats and uncertainties around something, and then you have a 15 seconds short clip of the final information without it being shared.
Yeah, it's kind of like some of the media training we do, right? Try to get down to that really succinct message, but it's difficult when you're explaining all the background of the science too. So I'm going to bridge off of that and ask you, I really was interested in your slide that talked about how you sort of changed your communication according to the different channel that you were using. And you really were able to identify and use which audiences use these different types of social media. So I know that you changed channels, but how did you actually change your communications messaging or the products that you put through that channel to better reach the intended target audience at the other end? Can you give a couple of examples?
Yeah. It has, the length is one of the most important points, just because of data capping and the dynamics of each social network. The length of videos that they share or that are mostly shared or clicked varies. So YouTube shares a lot long videos. They prefer longer videos. WhatsApp, it's mostly 10, 15-second clips. Instagram shares mostly 1 minute videos or less. So you have to target it. And then when it's shorter and I know it's going to reach a broader public that I can't control or that doesn't consume me regularly, I have to tailor information. So for short videos for WhatsApp have to be way simpler, way more synthetic, and give practical advice. So use the mask like this, use detergents to clean your hands or something like this. Instagram also has to be similar to it with more practical information. And on YouTube, I can just give longer explanations that people will listen to them repeatedly or use them in classes, lectures, as sources of information from somewhere else. And on Twitter, it's mostly emotional content. People share mostly what indignates them, what rages them, what makes them feel happy. So you have to know how to present something with a bit of emotion there. It's going to be way more shared, way more clicked, but then contain yourself to still keep representing information as it comes with uncertainties and everything else. So it's really hard to tailor information to each social media.
Great, thanks for that overview. Okay, this will be my last question, and I'll go to you, Attila, and then I'll give Alexandra the last, statement for the day, so to speak. So I'd like to kind of go back to this question that was asked earlier in our session, and that's how can we combat mis or disinformation from other scientists? I think probably you've both been in that sphere where you've had to do that or studied how to better manage that process. So I'll start with you, Attila, and then I'll go to you, Alexandra, for the last word.
My personal take is not to engage in fighting with disinformation, or especially with people. When you have fights on social media, it attracts attention, but it's usually the wrong kind of attention. And people get the feeling that it's still up for debate when it's something that is settled. So I try not to engage in discussions that will make people believe that point is still uncertain, and there are points of view. Sometimes there are no points of view, like masks work. There's no misinformation in this. There's no there's no reason to discuss it in this point. So I try not to engage in those discussions. And it's also a matter of being present there, because differently from TV, newspapers, and everything else, where journalists will seek you to get that information. In social media, it's the clicking of people and sharing that will make information go anywhere. So if we are not present there, if we are not making an accessible content with empathy to how people consume it, there won't be any information where people seek it. So young students seek information on Google, YouTube, WhatsApp. If information is not there, they will only get misinformation. They will not change channels and seek it somewhere else. So we have also to be present, at least available there to be consumed.
Right. Okay. Get our messages out where people are already looking. And Alexandra?
Well, yeah, no, misinformation from other scientists is a very tricky topic, and not one I know much about. But I think it's very important when you're communicating to preempt misunderstandings and get in there before people have already misunderstood something. So, by testing out, just chatting to people about the sorts of communications you're about to use, you can get an idea of what people might get the wrong end of the stick about, or you might have heard already on social media what people might misunderstand from this. And preempting that and saying, this doesn't mean X, or you might hear this, but this isn't the case because, gets in there before those sort of thoughts crystallize in people's minds. And I think everybody's very aware of not wanting to be tricked or caught out or misled by anybody. And if you can help them not be misled by anybody, then that's a really important positive thing that you can do for people, and say there is some misinformation out there, or it's really easy to misunderstand this to mean this. You may see other people making this mistake. This is why it's not. This is why it's a mistake, and you can help lead people into the right way of interpreting that. And I think that can be very powerful. So my advice would be to preempt misunderstandings.
Great. Thanks so much, Alexandra. I want to take a moment to thank all of our presenters for today. Thanks so much to Shamila, Vish, Susie, Alexandra, and Attila for taking your time. We've held at a solid 1,000 participants throughout the entire few hours you spent with us. So that's really a testament to the interest and again, the passion that you displayed today with this topic. I'm going to turn it over to my colleague, Tim Nguyen, who's the unit head for high impact events preparedness here at the World Health Organization, for closing remarks. Thank you.
Thank you, Mindy. It's my pleasure just to wrap up the first day of an exciting 3 weeks of science communication discussion that is following today's opening. Just want to have one reflection and thank all the speakers and underline this. Susie, I just wanted to really send you also a big thank you because you help also, with your flatten the curve graphic to help my parents understand what they can do in this context. Actually, it was the first time when I saw on a Facebook tweet by my mother that she used this graphic to also explain to her group of friends on Facebook what they all can contribute. And achieving that, with all the lay people that surround us, and helping them to find the right information at the right time in the right format, to save life. I think that is so important. What you all here on that panel, achieve through your communication methods and styles. I think this is where hopefully in the next 3 weeks we will discuss also more how we can measure that impact of good communication and demonstrate how the right information in the right format can save lives. We saw already a graph, I think, which was showing this around knowledge and misinformation, where misinformation might lead to non-adherence to certain measures, whereas good communication and knowledge, increases higher adherence to these measures. So hopefully, through our discussion, we can also look into measuring, this kind of interventions and show the benefit that good communication, good science communication can achieve during this pandemic. There are also many people to thank who have helped organizing this conference. So I would like to thank Mindy for excellent moderating and facilitating this opening. Thanks to Ramona and Judith, who masterminded today and the next 3 weeks what is being discussed and how things are being put together. Also thank Khaled, Shiva, Kat, Andre, and Aisha being in the background and supporting this event. In the next 3 weeks, we will have 13 additional sessions. Most of them, 12 of them, will be closed, where we'll be going into really detailed discussions and picking up on a lot of the themes and ideas that were proposed today by our keynote speakers, and really dissecting and distilling that really down to concrete ideas and recommendations we can take forward to improve science communication during a health emergency. We will have a track discussing on the science of research communication and how research community can contribute to that. We will have a track discussing media communication, journalists to contribute to science communication and the lessons learned from this area. And we will have 2 tracks really discussing the knowledge translation aspect of this, really how decision makers can improve communicating science to why they are taking certain decisions, and also to new formats of communicators that have emerged during this pandemic and have really taken up the responsibility. We heard about Attila's work, but there are also other very important YouTubers, bloggers out there, teachers who have taken up, and healthcare workers who have taken up new roles of communicating what they know and how they are reaching their communities. And we will have several examples discussing this, so watch out for that space and the concluding and closing session of this conference, which will happen in 3 weeks on 25th of June, where we'll come together for another 3-hour session to do 3 things. The first thing is we're hearing back from these close technical discussion of experts, what they have discussed and learned and would like to share with the world. So that's the first thing we will do on the 25th. The second thing is we will hear another set of amazing speakers to share with us their approach and their solutions. And thirdly, we will hear from you actually. We have asked for submissions of good practices of science communication during the pandemic. At this point, we have received almost 74 submissions from all around the world with concrete examples how you have supported the science communication during this pandemic. And we will be showcasing some of these good practice examples and showing you what you can maybe, in your communities pick up and adapt to your audiences, to your family and friends. And hopefully that will be good lessons learned, not only for this pandemic, but for future pandemics that might become, also to be adapted and be better prepared for this situation. So we're looking forward to welcome you back on the 25th of June. On the WHO website, you will find the registration link for that event to hear all about what we learned and discussed in the next 3 weeks. With that, I would like to thank our keynote speakers, our organizing committee, and you, the audience, for coming together today. Thank you and goodbye.